Okay, I think we are now live and transmitting our public meeting. So welcome everybody to our public board meeting for NHFT, and really pleased to welcome some colleagues who will be doing our presentation around our patient story. We'll introduce them shortly. Before we do that, just a reminder to everyone that the meeting is being recorded, and we have the opportunity for members of the public and governors to observe us. I don't know exactly which governors are observing us today, but I certainly would want to welcome people who are. Also want to welcome Janine. Nice to see you, Janine, who is Acting Operational Director of Finance and covering for Paul Sheldon today, and also Alison Gilmore, who's Director of Strategy and Partnerships, deputising for David. So welcome to you both. We do have apologies for absence from Julia Curtis, Deputy Chair, Non-Executive Director, Paul Sheldon, Chief Finance Officer, Anne Rackham, Chief Operating Officer, and David Williams, Group Director of Strategy and Partnerships. I'm conscious it is half-term week, I think, so that no doubt people are on leave. So welcome everybody. Can I just check any declarations of interest in relation to items on the agenda, please? Okay, thank you. Right, so we'll crack on with our beginning items of business before we get to our patient story. Minutes of the previous meeting held on the 28th of March, paper A. Can I check whether colleagues are comfortable that they're an accurate representation of our meeting and that we're happy to sign them off? Okay, I'll take that as a yes. So the minutes are approved. And are there any matters arising that are not covered on the action sheet? Okay, so looking at action sheet B, paper B, we have no outstanding actions on the first page. We were due to have the estate strategy, the annual plan arising from that. We were originally expecting it previously, but I think because of the capital allocation situation not being confirmed, Paul asked for that to be deferred, so that's now not due until July. And then the other item relating to estate strategy is not due until next year anyway. So perhaps, Richard, we could move the second item just onto our board work plan, because I think that ought to be an annual item, and then we won't carry that as an ongoing action. I think that might be quite helpful. And are there any comments or questions regarding the board's forward plan, which is paper C, which just sets out what we're expecting to cover for the remainder of the year for 24-25? Okay, thank you. So delighted that we are welcoming colleagues for our patient story. In Anne's absence, I think David Mayer is going to introduce the story, which is from HMP Swinfen Hall. So over to you, David.
Thanks, Christine, and hello, colleagues. I'm really delighted to welcome Angela and to Carol, and they'll explain the guest that's joining us from Swinfen Hall. This is one of our Staffordshire services, so it's outside of our normal patch of services. So I'm really delighted to be here. Angela, I'm going to ask you to just come in and just describe the service as service manager, and then hand over to Carol to take us through the patient story. So warm welcome again.
Hello, good morning everyone. I'm Angela Venables, the Inspire Service Manager at HMP Swinfen Hall. So we actually deal with emerging personality disorder individuals for young adults within Swinfen. We've got 4 services now as part of the OPD, of the Offender Personality Disorder Pathway. And we have like a crisis intervention, which is ESS, who deal with the most disruptive prisoners within Swinfen Hall. We've also got an assessment and treatment service for long-term serving prisoners, and we've got a PIPE, which is a psychologically informed planned environment. But also we've been grateful in having the non-residential treatment service, which is known as an outreach service for individuals that don't necessarily feel comfortable in accessing the residential service. So we're really proud because we are the flagship of offender personality disorder service within the UK. And also we did also get clinical team of the year back in 2021, and we're forever growing as well. So I will hand you over to Carol and Kate and our service user, who is going to be fantastic. So hand you over to Carol now.
Oh, good morning. I've just kind of given a little bit of background to ESS. Sorry, we've done a, yeah. So I think, what is ESS? The service is very much about a psychologically informed service. We don't actually work with people who have emerging personality disorder. We work across the estate. Anybody can be referred, and really it's anybody who's disruptive. So we are a person-centered treatment service, and also a very small team. So we have a prison officer, a specialist nurse, and then myself, the clinical lead. And we'll hand you over. I won't waste any more time talking about the service. I'll hand you over to our service user. And for understandable reasons, we're keeping his identity anonymous. Okay, thank you. I'll hand you over to Kate, who's going to be asking him some questions.
Morning. So we're going to keep him off the camera so that we can keep him completely anonymous, and anytime we refer to his name, it will be a pseudonym, it won't be his actual name. So I'll crack on. First things first, what was your behaviour like prior to ESS?
So before ESS, my behaviour was a bit erratic, kind of all over the place kind of thing. Well, like when I first came up, I started doing this not long after I got sentenced.
Okay, thank you.
So I had a lot of emotions, and kind of not really a plan to where I wanted to be or who I wanted to be.
So what sort of things were you doing?
So I was getting in a few fights. I was getting in a few scraps. I was getting nickings here and there. I was getting a few nickings here and there. Yeah.
So can you remember what it was like when you were referred and what your experience of the sort of referral was?
So I got referred by my OMU. Not sure if they know what that is. Yeah. But basically like a sentencing officer. She came to me and she told me about ESF. She explained it to me. She said, you go down here and you talk about things. And at first I didn't want to do it. At first I thought it was a silly idea, to be honest. I didn't want to, I was in prison. I didn't want to go down and talk about my feelings or talk about what was going on in my head or my life or anything. It didn't really make sense to me. But yeah, I think, yeah.
And when you joined ESS, what was your experience of that? How did you feel when you came up here?
Yeah, at first I didn't want to do it. But yeah, eventually it became probably the best thing I ever did in prison. Because not even just in prison, in my life, to be honest. Because when I come in here, it changed a lot of things in terms of my mindset and my mentality and how I approach certain situations. So how I would have approached them 2 years ago. Or like, you don't have no end goal, or you don't have no guidance. There's not really a plan on what you're doing when you come in. There's not really, you ain't really got hope of what you can become. ESS just helped me to see what can be and what I have to lose. and what I have to gain as well. You get me? So, but like, yeah, like coming in, change my perspective.
Mm.
But yeah.
So now that you've completed the service, how do you think that things have changed for you?
Like, a lot of the issues when you come into prison is you don't really see what it could be when you come out or when you leave. But everyone just goes into panic mode. And they kind of go into self-destruct mode because of it. They don't really know what's going to happen to them. They don't really know how they're going to do it, kind of thing. But I know I'm not. I used to have a lot of anxiety. I used to have a lot of nervousness. I never knew where it came from. But like this kind of calmed me down and it gave me an idea of what I want to do when I come out. I feel like when you have that plan in your head, naturally your day becomes a routine. Your day becomes not like a timer, but every day you're getting closer to what you want to be, and every day you're doing things to make sure that happens. To make sure you're ready as possible for that situation. I never had that before ESS. But
So do you think that your behaviour's changed as well since
it's
ESS?
definitely it's changed a lot. And even my family can't believe it sometimes when I see them on visits and this and that. It's not about not being in fights or not. I think it's just you've got to not be so hard on yourself, kind of thing. Because that's where it starts. When it truly starts from within yourself, innit? You don't really value how much your own mental health is and how you see yourself is when you're in a situation like this. And then, yeah.
So you're now our peer mentor on the wings. So what's your experience of that been like?
So on the wing, I talk to prisoners like myself, or prisoners who were where I was in a certain time, and I feel like it's one of the best things I've done, to be honest. I go out there and I help individuals, whether they have problems with officers, other prisoners, if it's just in themselves, or they need to talk to someone or let some stuff out and just vent and just be for a minute. I'm the person that they'll come to, and it's not always. I think it's not always as easy as you think. So I feel like myself coming from where I'm coming from and actually being a prisoner relating to them, but also being able to listen to them and deal with their stuff and their emotions and what they're dealing with. I think it helps, to be honest. It's trust. I think they trust me enough to let me in, kind of thing. I enjoy it. I love it.
So can you now see what your life could be outside of prison?
Of course. Yeah. I think it's as simple as just being decent, innit? You just want to be a decent man at times, you get me? So for that, yes, this has definitely helped me to see that a lot better. And as I get closer, I get a bit more a warm feeling, kind of thing. You kind of just know there's not that much to worry about. So I do want to do something like this when I come out, and I want to try and incorporate this into something I actually do. It's not just a living. I don't see myself doing anything else, to be honest. I like doing this.
So you want to continue to help people outside of prison?
I'd like to think I can still. I hope so. I hope so.
I think that's everything.
Okay, I think unless people have got any questions, I think that's everything.
Well, take a deep breath. Thank you so much. I feel quite a little bit emotional, if I'm being honest, just hearing that. So thank you, and thank you to I don't have a name to use, but thank you to our friend who's helped us understand his experience and story. I think we'll obviously take your judgment as to what questions can or can't be answered, Carol. because, you know, obviously because we need to respect the circumstances and the confidentiality that's needed. So so I'll open it up to questions, but you just let us know what you can and can't answer, and we'll go with that. So Joanne, please.
Thank you. I was fortunate, along with Melanie, to visit Swinfen not long ago, and Carol and the team welcomed us with open arms. It's not a question, I just want to put on record. First of all, I'd like to thank the bravery of the young man who's just talked to us. He's truly inspirational. He's creating a new future for himself, and he should be so proud of what he's achieving. And the work that the team do, Angela and Carol and the team, they have significant impact on the lives of these young men. So what you won't know, Angela and Carol, is when I came back from Swinfen, I did a short note to my colleague non-exec directors, and I just want to read 2 sentences at the end of the note that I shared with colleagues. So I said in my overall conclusions, all of the staff that we met were absolutely brimming with enthusiasm and passionate about the work that they did. It's clearly a harsh working environment, and it relies on constructive personal relationships between the service users, the young men within Swinfen, prison officers and health staff, and we saw nothing but positive outcomes. So I'd just like to thank you for the work that you do and the extraordinary impact you're having on, it's a small number of people, but you cannot underestimate the impact that you're having. So thank you.
Thank you.
Thank you, Jo.
Thank you so
Angela.
much.
Yeah, again, building on what Jo said, a big thank you for sharing your story, but also for the work staff are doing, because, you know, it oozes compassion, it oozes real passionate approaches to care, and it's clearly making a difference. That's really, really encouraging. And I know that you know that because you are the exemplar, but it's important that we say it to you as well. So hopefully you're hearing that. But in terms of the story, again, very, very brave to share any story, any personal story, but I'm really pleased that you got referred, and I'm you know, really pleased and encouraged that you took that step, even if you were reluctant to start with. And that is something that hopefully you can encourage others to do if they're reluctant as well, because of that that journey that you've been on. And it's really pleasing that you see the change in yourself, but your family are seeing them too, because that's really good for you and good for them. So my question then was to the team around, it's clearly good work, there's lots of great outcomes, and is there an ability, and are you influencing pathways elsewhere in other parts of the country or in other parts of the prison population? It'd be good to hear a little bit about that, please. Thank you.
I think our officer does an awful lot of work within the prison, and he works on the wings. We have liaison officers, which is a voluntary role, kind of as culture carriers, and to support the people that are in our service, because we only see them once a week or once a fortnight. They have to go on to normal location where there's very little support because people are so busy. Nationally, I think that we've had a real impact, and have been asked to speak at conferences. So when we set up, there were 4 ESS services nationally, and they are looking to expand that number. And we've been at the centre of people visiting, and happy to share, because we really believe in the service. We really believe in the capacity to make changes. So we're happy to share anything that we have with other new services.
Thanks, Carol. That's really encouraging.
I think in addition to that, Angela, as well, that Peterborough have just won the contract for NHFT to set up ESS, which is absolutely wonderful news for the trust.
Yes.
But also as well, the other services that we've also expanded those, and we're going to be presenting at, it's called the Big Spud Conference. It's at Belfast, and we've got an ex-prisoner that is doing the presentation with our existing staff team and also the prison officer as well. So the partnership approach is just wonderful, and we're able to present there, which is a biggie, really.
That's fantastic to hear. Thanks, Angela. That's really, really encouraging indeed, and well deserved.
Thank you.
Okay, so next we have Tim, please.
All right, thank you very much. I mean, truly an inspirational story, and I'm particularly struck by how the young gentleman moved from reluctance to ambassador, which is an awfully long journey to go on. I think my question to you all, and I can see it actually coming through in the work he's doing, is how do you overcome that barrier to entry where people see it with natural reluctance? They don't want to go into the service, but actually once they're over that hurdle, they see the benefits. I think that's probably just something I'd like to understand a bit better.
Okay, we do have, I guess it's an informal system. Our officer goes out to meet people. Sometimes it takes 2 or 3 contacts and he doesn't give up. So even if people tell him to go away, he will come back and say, you know, just come on, have a coffee with us. We're famous for our coffee and biscuits. And he's very confident, and he's said this, which gives the team confidence really, that if he gets them up to this department, to our room, to our space, then we'll hook them. And sorry, that sounds awful, but and that happens. So I think we've had one person in the 4 years we've been operating who's actually got into the department and said, no, this is not for them. Normally when they get up here, and that's a high percentage of people, then they engage with us. And I think usually it takes about 3 or 4 sessions, is that right, before you kind of say, I'm fully committed?
Yeah. It took me a couple of sessions. Yeah. I think it's just a trust thing, to be honest.
Yeah.
I can trust you.
Trust happens quite quickly because we only have 12 weeks to work with people as well. So, yeah.
I think what's also been really important is our Governor, Laura Whitehurst, has massively invested within Inspires and understands, and I think that's a massive part of the partnership that's really helped us to be able to embed within Swinfen. It's been 10 years since Inspires has been open, 4 years for ESS, and our newest baby is the non-residential service, which is still we're recruiting for at the moment, but already we're up to maximum numbers, and I think there's a massive need, not just in Swinfen but within a lot of other establishments as well, for all of these services. Personality disorder and emerging personality disorder tends to fall sort of underneath mental health, so it sometimes can feel like it's a little bit lost, but the relational models that we all work towards, and certainly within the most challenging environments, if we can do it here, we can do it anywhere.
Thank you. Melanie next, please.
Hi, yes, thank you, and thanks, Angela, Carol, and everybody. As Joe said, we had such a fantastic visit to your facility. I'm delighted to hear that you're having an influence on sort of national strategy maybe, and the opportunity to roll this out, but I wonder whether we're doing enough, and I suppose I throw down a gauntlet of challenge, if you like, a little, to Angela, to David, and to Krishna, and maybe the board as a whole, to think bigger about how we influence, because the impact that this service can clearly have should be available to every single prisoner who chooses to engage with it, and who sort of meets the criteria, if you like, but recognizing that it's a really sort of blurred environment. And I wonder whether we're just showcasing what we're doing enough, whether we're having conversations that support and building on the incredible impact you're having across your services and the commissioners, and how we can augment that really, and have an even bigger impact, because the evidence of what's being achieved is so clear.
Thanks, Melanie. Dave, I saw Dave and Angela's hands going up, so I'm going to bring them in just to engage with that. Dave?
Thanks, Melanie. I mean, it chimes with what I was thinking, really. Well, what I heard really was a real great exemplar of social justice, a real great exemplar of embedding hope and a future into everything we do. So I agree, there's a model here that helps achieve that. And I also really like the language you used, Carol, about cultural carriers. I thought that was a really interesting phrase. So there's lots for us to compute in that and to think about, but I agree entirely. We'll got a recording of this. I'm going to make sure Anne's team and others have a look at it, and we can begin to work up similar plans around that social justice and hope theme, which we do already, but I think this is a particular pocket that does help specific individuals. So I agree.
Thank you. Angela, did you want to come in on this as well?
Yeah, just agree with all that, but I think we probably need to specify for David Williams as Director of Strategy and Partnerships to really sort of try to capture the evidence that we are influencing and that we can, you know, we may not be able to, but we need to try to, and that's the important point here. So I think, you know, perhaps an action for David to take that forward in terms of let's capture the evidence, let's understand if we're having any impact, and is there more we could do in his role, please.
And Angela, is there anything? I mean, I'm conscious the East Midlands Alliance is not, you know, is only you know, in terms of scale, but is there anything we can do through the Alliance and using the Alliance's voice to promote this? I don't know how many of the Alliance partners are involved in prison healthcare generally anyway. It's quite patchy, many, isn't it?
Yeah, it is. So I think it's on this occasion, it's probably not the vehicle. Yeah. I think probably through David's work, the sort of the commissioning areas, I think that's the way to go, as well as what Angela's described in terms of national conferences and making sure that we're reaching those. I think that's the way forward in this one.
Yeah, thank you. Thanks, Angela. Okay, Linda, please.
Thank you very much, Krishna, and good morning to everyone. I just wanted to really thank Angela, Carol, Katie, and our peer mentor for coming and sharing this really excellent story of how lives can be transformed, which is what we aim to do in NHFT, to really make that difference for the people who use our services. I was fortunate to be at HMP Swinfen Hall last Friday on the 24th of May, so I had really first-hand experience and was able to join in some of the groups and actually meet some of the young people who are going through exactly what our peer mentors just shared now, where they do have those feelings of hopelessness, or they've given up on themselves, and a lot of the people referred actually don't want to engage, and that's not because they don't like the service. They are in that mindset of, this is it, the book has been thrown at me, so why should I care? But the team approach is what came through. The culture from the team, as well as the team making that contact, then leaving it to that person to consider. And then afterwards, for most people, they then do decide to take up the offer and engage. I was fortunate to speak to a young man who shared that he had gone into Swinfen Hall as a young man. So I won't say the age exactly because it could easily identify the individual. And what struck this person was that years later, you would then be expected to leave prison as an adult, but actually, where do you get those skills? The relationships have not been positive relationships, so a lot of them have not had that supportive family network. They've not had that positive influence. So what they start to identify as being important is learning to have that relationship with themselves. And actually, the team does a really good job of doing that. And I was able to see quite a lot of people saying, I've learned a lot about myself. And then the trust starts to develop, and they start to understand that they can make a difference. They can change their own lives, and actually this is not going to determine their future, whereas previously it would have determined their future. I spoke to someone else who said that having the peer mentor has been instrumental because you get to hear from someone who's walked the path that you're currently walking, someone who has an understanding, and then sometimes coming out of one-to-one sessions, it opens up some really raw, painful past traumatic experiences, and the ability to have a peer mentor who actually says to you, it feels quite rough at the moment, but you'll get to it like I've got to it, is making an absolute difference. So I just wanted to share with colleagues this morning that the team do a lot of work in the background. They do undersell themselves. And I'm pleased because at our annual nursing conference this year, one of the areas we highlighted was prison nursing. So going into HMP in Swiffen Hall last Friday, one of the things I took away was to go back and start looking at, when we talk about our recovery and rehabilitation models, are we actually including this as well? Because we are supporting people to recover, we're supporting them to rehabilitate, but is that as amplified as when we start talking about older people who've gone into community beds and off they go, someone who's gone into another pathway of our crisis pathway? So that's the bit that I want to take away and champion, so that it's absolutely embedded in all the other platforms that we have. And I take on what we've said around making sure that we are influencing, and certainly I'll be able to share this with other colleagues in the various networks that I'm part of. Thank you very much, Chair.
Thanks, Linda. I think that's a really good point about, we talk about recovery and rehabilitation, but we don't always describe the different services that don't naturally fall into the way we used to, the sort of the historical descriptions. So actually there's something, I think, in that action about thinking about how we describe the work that we're doing that very clearly positions it alongside that recovery and rehabilitation. Really, really helpful. Thank you. Saqib, please.
Yeah, I just wanted to thank the person for sharing his story, and I think it takes great bravery to make that first step. As somebody that's used being a service user in the past, then I think both from a cultural angle and just being a male, sometimes making that first step is really difficult. And I think it's also really inspiring to now see that he's able to take this beyond you being a user, to share his experiences with others, and then hopefully once he comes out to be able to share that good work with others. And of course, I want to thank the team for sharing their work and carrying on what everyone has said is, wonderful work in difficult circumstances. My father used to be an imam in prisons, so I used to get an insight of what it was like to often talk to perhaps similar age people that were often on detention in Bedford before they went elsewhere, remarkatory. So thank you.
Thank you, Saqib. Thank you. Robin, please.
Thanks again to all those who spoke, particularly, of course, to our service user. Thank you so much for sharing your experience, and really, I hope you stick with it in terms of what you're trying to do to go into perhaps this kind of work in another way or another setting, and also whilst you continue to be in the prison. So thank you so much for sharing that. I really welcome that, and obviously the staff. I was going to make a more general point, though, about prison strategy, because what we've heard here is a really brilliant example of excellent work that's happening that is clearly making a therapeutic benefit to a lot of patients. We sometimes, in some of the other reports we get about prisons, we don't hear as positive stories. And yet we've also heard today a really positive mention of replicating some of this experience at Peterborough, which is a prison which has had a lot of issues. So it would be really good, as we have asked in previous meetings, to have a more substantive discussion about prison strategy at board level, where we can examine our kind of approach, where we're going as a whole, because clearly trying to do this kind of work is exactly what we should be doing, because this really makes a difference to patients and people who are in prison. So it would be really nice to have a sense of our ongoing strategy, where we're going with this, and how we're going to try and influence, as has been said, more of this kind of work in other areas. But I would welcome that more substantive discussion.
Thank you, Robin. And I'll just sort of look to Angela and Dave as to whether we can maybe factor that in, but perhaps into a board development discussion initially.
Absolutely.
What's your thoughts, Angela?
Yeah, no, I think it's timely, and as Robin said, there's so many aspects to it. I think board development session feels appropriate, and equally the prison environment is changing, and the complexities within that I think is important for the board to be cited on, as well as the examples of good practice and things that we need to consider, the risks, etc. So I think that'd be really good, and I think a combination of David from a strategy point of view and Anne from an operational point of view would be a good session to take the board through.
Thank you. Richard, can we factor that in, please, into our board development plan? So there were two actions really. One is just thinking about how we capture the evidence of the work that's being done and the impact of the work that's being done to translate into a national story, a national case study, to try and sort of increase our influence around this agenda, and a second one to plan into our board development programme a discussion about broader prison strategy. I will bring you back in, Angela, but I just also wanted to just comment finally myself, just to say, really, I mean, I won't repeat what everyone else has said, but I did find it incredibly inspiring. Thanks particularly our peer mentor. I thought Tim's point about, you know, going sort of that starting from reluctance to going to becoming an advocate. It feels so important, because every time we hear, and actually, you know, obviously this setting, the prison setting, is particularly challenging, and for the young men and the young people involved, obviously that journey is very difficult. But we have heard repeatedly how people who start on the journey of getting really good support and care and treatment actually turn into peer support workers in whatever context, and the amazing transformation that can have. That feels to me like something we've heard repeatedly from patient stories over the years. So I would really encourage our peer mentor to continue the great work he's doing, and hopefully turn that into something really positive for the future, because I think, you know, so many people have benefited from that experience, and it's become part of what we do in the NHS to employ people in that context as well. Angela, a very practical question before, and then I'll bring you in if you want to make any further comment before we close. I couldn't help noticing that on the slide that Carol put up, there was NHS, obviously Northamptonshire, but also Midlands Partnership. So just wanted to check my understanding of the relationship between the two organisations. I'm assuming there's a joint healthcare operation, but it would be useful just to understand that and how that works, because that's potentially another example of partnership working, which is important to highlight.
So ESS is a team of 4. So Carol is the clinical lead who works for NHFT. We've just employed administrator who will also be NHFT. Kate actually works for MPFT, which is the mental health and substance misuse provider within Swinfen. And then Matt is the prison officer. So for a very small team with a massive impact, we've got 3 partnerships, and it is quite challenging. So I think Peterborough in some respect have learned from Swinfen, because at times that is very challenging. We're not the primary healthcare provider within Swinfen Hall, and we've had to work through some challenging times and some difficulties. So yes, I think it is a tricky one within a small partnership. So there's a lot of time actually spent sewing different partnership strands together, from information sharing agreements, system 1, risk assessments, supervision, line management. So that's something to consider, I guess, moving forward within that structure. I don't know if Carol, you want to sort of come in on that, and Kate?
I guess on a personal level, the team actually function very well together, even though we've got 3 different managers. And that's because we're all very clear about what we're here for, and we get on well as a team. I think the external pressures have a different impact. And I guess for Kate, it's meant that she's has been able to observe a different kind of experience with NHFT, and actually would have liked to have been employed by NHFT. I don't mind me saying that, to the point where you're actually looking at going.
Yeah, I think that the difficulty with the 3-way funding is that, for me, sitting in this position, that gives me 3 different managers, 3 different sets of KPIs, 3 different expectations, and it's a really challenging position to be in when you're the person on the ground, essentially. I think that the the prison relationship has its challenges, but we all work for the prison, whereas when you're in the nursing role that is NPFT funded by an NHFT, under an NHFT umbrella, it makes it really challenging because my trust wouldn't necessarily see why they would invest in me, because I don't work for them almost. I work for NHFT as well. So it's a really challenging thing, and it's been really difficult, and it has actually pushed me to the point that I will be leaving soon, which is unfortunate, but
Well, it is unfortunate to hear, Kate, because that is something I think but you know, there are some lessons for all of us, I guess, in just thinking about, you know, whilst the partnership working is really important, and you said, I think having a common goal helps, doesn't it, to keep you all focused on what really matters. But I think it's up to us as employers and organisations involved in the partnership to try and make sure we remove the barriers that might be getting in the way of you doing the best you can. And that might be part of what we need to think about, I guess, in our strategy and our, you know, and our thinking about how we deliver services together, particularly in these more challenging environments where you've also got, you know, the prison service itself as a key partner. But thank you so much. I mean, Kate, you know, I hope you find your way around to a well, hopefully you'll come and work for us. Maybe that's one of the options.
That's what we're hoping for.
Just
a couple of things.
Just to put that in there, not to be publicly advocating poaching other people's stuff, but there you go. But I do want to say thank you. I mean, you know, it's a really important story, and I think what you described was, I think the words life-changing came in there somewhere, and it is really important to remember that can happen in the services that we provide, and how we, therefore, you know, how we try and take that and translate that into the biggest possible impact is really incredible. So thank you so much. Thank you to our peer mentor. Wish him all the best and hope everything goes well for him and whatever happens next. We're rooting for you. And thank you, Angela, Carol, and Kate, for coming along. Angela?
Yeah, I just wanted to add to the board that in my career, sort of, I suppose, starting out, I have got 20 years prison experience before joining the NHS. So I'm a bit of a dual person. So it's nice to be able to sort of still speak the language of prison, but at the same time look at it from an NHS point of view. So if ever you need any advice with regard to prisons, then I'm more than happy to sort of help and provide and support NHFT from a completely different angle. But I also wanted to say thank you as well for having the opportunity for us to showcase to yourselves, and certainly we've had a massive increase in directors coming to visit us, so please continue to do that. We do feel really supported from your level as well, so we really appreciate that.
Thank you, Angela. That's really good to hear, and I think, you know, I can see why you won Clinical Team of the Year along the way. There are obviously some huge things that you've achieved, but really helpful to make that offer, Angela, because, you know, all experience is welcome, isn't it, in trying to make sure we translate this into a wider offer if we can. So thank you so much. Dave, any final comment from you?
No, I think the team have said it all, and I think we've been inspired to go further, and the hope is the bit that is living with me, that responsibility we have to give people hope. So we shall go forth and think further on that. So thank you.
Thank you. Thanks again, everybody. Thank you. Right. We need to move on with the rest of our agenda. We did carry on a little bit longer than we were planning to, but I think it was a really important story to hear and explore, and a lot of learning from it. So we move on to talking about risk, which is the next part of our agenda. So I'll bring in Richard to talk about the board assurance framework on paper D, please.
Thanks for that, Krishna. Yes, a bit of a hard act to follow, actually, but nonetheless, paper D. So board members will see from the report that we have received a positive outcome from the annual risk audit undertaken by our internal auditors, which is pleasing. The audit committee were able to consider the full report at its most recent meeting and took assurance from the findings and also the action plan that we've put in place. As the board is well aware, we've been on a risk management transformation journey over the last year or so, and we're planning to complete the current phase of work by the end of June. So the sort of full BAF will then be available to board members, having passed through committees beforehand. And as part of this work, we've been in dialogue with committees about how we can better present the information that we have on controls, assurances and gaps in terms of the cause and the effect for each of the risks. So we're doing that work at the moment with executive colleagues, and committee members can expect to receive some refined information at the next meeting of each of the committees. In terms of the actual level of risk, board members will also note from the report that the overall level of risk to delivery of our strategy has remained largely static since the last report to the board. I just wanted to draw out the commentary in the report regarding BAF 7, largely because we've omitted some more contextual information that might be useful to board members and those observing the meeting. So BAF 7 was a risk relating to the effectiveness of our data analysis and informing our approach to population health management. We had a helpful conversation with the performance committee about the progress we were making with this risk, and pleasingly we reached the target risk score. As a consequence of that, we had a discussion in the executive risk group and decided that this risk could therefore be stepped down, and we are then considering whether there should be a successor risk concerning what we're now planning to do with data and analysis. So more information will come through the next meeting of the Performance Committee on that front. But I hope that's a bit of helpful additional context in relation to the commentary in the report regarding BAF 7. So with the interests of time in mind, Krishna, I'll hand back to you for any questions or comments from board members. Thank you.
Thank you, Richard. You did anything? I was thinking of bringing you in, Judith, in case you wanted to add anything regarding that risk or further discussions of performance. So over to you first.
Thank you, Krishni. Thanks, Richard, for the report. Congratulations. It was through audit committee. It was really good to hear and get that assurance around not only the good work that's being done through transferring the entire risk management process into BAF, but also around the routes of escalation, because that's really, really important for us to be assured over. What I just wanted to ask, and no, I don't need to comment any further on what was discussed at Performance Committee. I will address some of that later on in any event. But what I just wanted to ask clarification over was the target risk score. I know that risk appetite is something that we as a board look at on an annual basis, but the target risk score is something that I'm not clear about what we do with. We know how it's set and how frequently we reset it or we reconsider it. So just wanted to ask about that. Thank you.
To come in on that, Richard.
Yeah, I can quickly respond to that one. A really helpful observation, Judith. So yes, we do look at the target risk score annually in conjunction with the setting of the objectives, and ideally are positioning the target risk score in relation to the risk appetite. So yes, we are due with the risk appetite review upcoming for the board to have a look at the target risk scores again as a board. So we can expect that to happen over the next couple of months in one of our board workshops.
Lovely. Thank you.
Thanks, Judith. Thank you, Richard. Joanne, please. Oh, sorry, no, Melanie. Numbers have moved, so let's go to Melanie.
You're all right, Krishna. Yeah, just one point on that before I come to my question. I'm not sure that I understand the correlation between the target risk score and the risk appetite, Richard, on that basis, given that Innovate has a significant risk appetite, but the lowest target risk score of all of them. So maybe that's just something to think about. But I had a different, slightly more general question, really, and just an encouragement, actually, to our executive colleagues, because I was I was interested in understanding the relationship between our strategy and our BAF. And later on, and I could have raised it later, but I thought I'd raise it now, we go through the strategic plan, operating plan delivery. And I note that everything is very positive. We've delivered a huge quantity of the initiatives within our strategy for this year, but with no impact on how we're scoring the risk, in that the risk has stayed very highly scored across that entire time. So our strategy does not appear to have impacted the risk. And I don't believe that's true, actually. I think the delivery of our strategy is having a positive impact on how we're mitigating the risks. But I'm not sure that we're reflecting that as well as we could be in how we're scoring our risk. Now, that might be because the risk score is a fairly blunt tool at the end of the day. You know, you've got a relatively limited range in which to score it. But I think we're doing ourselves an injustice by not reflecting on how the delivery of our strategy is mitigating risk. And I wonder whether we could reflect that more in how we're scoring. So I really just give that as a bit of a challenge to our executive colleagues in particular to reflect on the strategy and the confidence that we're delivering the strategy and that it is having impacts. And maybe we should be challenging ourselves a little bit more with how we then rank the risk. Does that make sense?
Yeah, it does, Melanie. Thank you. Richard, I don't know whether you wanted to comment on that. I know I saw Chris wanting to come in as well, so I'll bring Chris in as well. But Richard, did you want to say anything? I mean, it might be part of a discussion we need to be having in the follow-up. So if we're going to talk about risk appetite and we've got a plan to do that, then I think actually making that connection and understanding how we look at that together would be good. Are you happy with that, Richard?
Exactly,
Yeah.
Christian, that's what I was going to suggest. Thank you.
Yeah. Chris, did you want to come in on that point?
Yeah, I was just going to say, I think Melanie's made an interesting point. Actually, Melanie would be aware that in the wellbeing group, we've had this very discussion about whether we should be moving the risk score in the light of all the work we've been doing. We haven't landed it yet, but I think there was general support from colleagues and Melanie and myself that maybe we should consider lowering it because of all the work we've done. So I agree it's a good challenge, but just to say that certainly in one area there's an emergent movement on that.
Thank you. Really helpful. Thank you. Joanne, please.
Thanks, Krishni. So Melanie's picked up on one of the threads I was going to explore, which is having read the papers under the strategy section. The two don't seem to correspond particularly well, because I think that our risk scores do need to be reflected upon, given the positive stories that we're talking about, particularly under papers G and H. Secondary strand is I understand the process, and I think Richard's team has done a great job in the transition across to the new framework. But given that we're entering a period of political instability, shall I say, do we think that annual reviews of the status of risk appetite and target score is sustainable for the short term? I mean, my proposition would be that we just need to maybe be a bit more agile, because once we know the outcome of the election, there's going to be a whole period of settling in. So might I suggest that audit group, or indeed performance committee, perhaps take a view on maybe a 3-month review of that risk appetite and target score in the short term?
Any thoughts on that from other colleagues? You did?
Yeah, Joe, I hear what you're saying. I'm a little bit exercised by the amount of time this would take from colleagues, from executive colleagues, for the sake of, you know, moving our risk scores by a couple of notches up or down. I mean, yes, for accuracy's sake, we should be doing it. I just don't. I'm not sure of the, you know, the negative impact that's going to have on everybody else's time.
Thanks, Judith. I think, I suppose my initial reflection, but it's one to reflect on further, maybe part of a discussion, Joe, that we can pick up at our board workshop as well. But my initial reflection is, I wonder whether the current, whatever the current situation, appetite as a board should really change that much over a period of time. Because yes, the risk might change, but I do wonder whether the appetite is actually should be more stable. I don't know. It's one to reflect on. It's an
I was going to say,
interesting challenge.
I think from a practical perspective, sorry to cut in, Dave, you know, it is that balance between risk and opportunity. And I think there may be some significant opportunities coming up in the short term that we need to be alive to, which may change our appetite on risk. But as you say, it's probably a conversation for another day.
Okay, thank you, Joe. Dave, please.
You're on mute, Dave.
I almost used a German swear word, but thankfully I was on mute. Sorry about that. I think Melanie's point about the link to the risk score and then deliverables, I think, is probably one well made as we kind of grow into the BAF to make those linkages between the mitigations that have been identified and then initiatives that have delivered. So, for example, we've scored down the digital, the data one, because we now have the NARP up and running, the NCR is functional, we're using the data set, so the risk has moved on that as an example. So I think what you've described is just a connection issue where people begin to make that mental connection between I'm doing something over here which is project related, and it also has an impact on some of the risks in the BAF. So bear with us, would be my view on that one.
Thank you, Dave. Okay, so I think at this stage we are really, first of all, asked to note the reasonable assurance rating provided by the Trust internal auditors. We've obviously considered the board assurance framework and noted it at this stage. I think we've talked about the need to revisit the risk appetite and reflect on some of the other parts of the discussion that we've had here. But that's something we can take time to do as part of one of our board development sessions. So I think, Richard, we've probably got all that scheduled in anyway on our agenda. Okay, great. Thank you very much. Thank you for that report. We move on then to our regular verbal update on just system-wide winter planning and risks. In Anne's absence, Dave, is there anything you particularly wanted to comment on?
Just for completeness, I mean, we've got 1 in 6 reporting influenza type symptoms over the last 4 weeks. So that is popping up in our services. So we have seen very stretched A&E, particularly over the bank holiday. The working days after the bank holiday have been particularly pressured. We have done our bit to support that with moving patients into care settings where we can monitor and keep them safe to provide some capacity. So again, we maintain a partner position in supporting that. There's a conference coming up in July, just that colleagues be aware of, focusing on UEC, which is looking to really begin to design a comprehensive strategy aligned to what we had with ICANN, I think, in terms of the bringing together of the overall spectrum of things that influence urgent and emergency care. So that is quite a significant workshop event, and my hope and our hope is that we will have a really crystal clarified, coherent program of change around urgent emergency care, which sustains us for the long term. And then just a final bit, again on partnerships, as part of our role within 360, the GP Confederation partnership, they also are supporting the development of a clinical service strategy in partnership with other confederations in the county, seeking to build in things such as acute respiratory hubs, some additional things that really bring to life that place-based work and the prevention agenda that we're working towards. So just those 3 kind of main themes, just to highlight to board in general. Thanks, Krishna.
Thank you, Dave. Any questions for Dave on that? Okay, thank you. We'll just note that update and move on to the AAA report, Paper E, from the Integrated Assurance Committee. So over to you, Tim.
Okay, thank you. I'm going to take the paper as read. There are 3 things actually I was going to bring out today. The first of which is the first time we've not had anything in the alert section of the report, so that's good progress. The second thing is that there's something a report can't capture, which is the journey we've been on with the IAC. And actually, the agenda setting has become far more focused, and the meetings have become far more precise, and actually the discussion's much deeper in terms of the quality of the conversation. So that's good progress, which I'd like to report to board. And then the final thing, because we have BAF 3 and 4 with the Assurance Committee for those, BAF 3, there's a very similar risk, which we discussed, Dave and I discussed at the ICB Performance Committee about industrial action, because the LMC or the BMAC Hub, which one, have written about general practice and their intention to take industrial action. The ICB have chosen to list that as an extra risk. We disagreed with that. We said actually it should sit in the industrial action risk, and we need to manage it in that way. So after this meeting, Chris and I have got an agenda setting meeting for the next IEC, and we'll have a quick discussion about how we want to handle that particular conversation. That's everything from the chair.
Thank you, Tim. Any questions for Tim from relating to the report? I think useful to note just that general sense of progress with the committee and the development of the committee, which is good. And certainly I just wanted to thank everyone and note, you know, the assurance around agency spend. I think that's the first time we've had a green assurance around agency spend, and it's a big focus, remains a big focus for everybody in the coming year. So I think to be able to start the year with positive assurance around that feels very helpful. And I just want to thank everybody, all the colleagues who I know would have worked hard to ensure that the controls are in place around that. Angela?
Yeah, thanks. Yeah, the only comment I would just ask is around the compassion commitment, which is obviously a significant piece of work for us. And my question would be, is that outstanding? Because we've got a very big piece of work, co-produced it. We've got obviously a lot of assurance around it, etc. It's just a question, not necessarily for answering now, but it's just something to think about, because we're getting more and more, if you like, clear on what we should be pulling out in terms of those areas. I just wonder if that's one of them. Thank you.
We'll leave that with the committee to reflect on, Tim, and think about what assurance you want to provide on the next opportunity. So thank you. Good to hear that update. We move on then to the strategy section of our meeting, which starts with our general environmental analysis. There's just a verbal update from Angela and other executives, if anything that feels appropriate. So Angela, I'll start with you.
Yes, thanks, Krishni. So just to share with the board that the Integrated Care Board, the ICB, has now appointed to its Chief Nurse Officer post an individual called Maria Laffan, who's current deputy in Luton and Bedfordshire system, so she'll be joining there. I understand they have appointed to the Chief Medical Officer post as well, but that's still progressing. Junior doctor strikes imminent again, so just reminding the board this is something that we've clearly dealt with well as a trust, but the 27th of June to 2nd of July it will be the period. And just to say that Julia and I attended a quality improvement conference with NHS providers. I have to say it was an excellent conference, really good thought-provoking material in it, which I'm hoping that we can share some of that thinking in future board discussions and board development sessions, and a real sense of how leadership behaviours impact on safety, which I think will be useful to explore as well in future sessions, Krishni. But that's all from my perspective. Thank you.
Yeah, thank you, Angela. And I know Julia sort of shared some insights from the conference with everybody. So we've had some early feedback, but it sounded like a really positive event. Thank you. Any other executive colleagues wanted to mention anything under that item? No? Okay, thank you. Move on to my chair's report. I'll take the report as read. I really just wanted to say that we had a really great induction session with our new governors, welcoming a really diverse range of new governors, of which a significant number of new staff governors. So we filled all our seats, which were competitive election process for those seats. and really got an interesting group of staff now involved in the governor role, which I think would be great, and also a very diverse and interesting new set of governors from real different backgrounds who've joined as public governors as well. So we had a face-to-face event at St Mary's. It's not often we use that boardroom facility now, but it was nice to be in the room together with colleagues and welcome them all. So obviously just look to the board generally to support their journey, because we all know that coming on board as a new governor, it's often a big development for people, and we're looking forward to the board and particularly non-executive directors supporting that journey. And of course, we did say goodbye to a number of other governors, and we did thank them profusely for their services. And many of them shared some really good insights into their experience, which Richard and I thought already about how we might factor into sort of making the governor experience as helpful and positive as possible. So that's all I really wanted to highlight. It was also great, actually, just to mention that I had the pleasure of opening the nursing conference with Linda. And Julia was also there all day. Unfortunately, I couldn't stay all day. I already had a lot of appraisals and things planned for that day, but it was great. Julia was able to stay for the whole day, and she also, obviously, as a nurse by background, I think it was great to have her there. And I sort of roped her into my opening and got her to say something about her journey as well. So that was really great. And I know Linda, she said it was a brilliant event. So so it's fantastic that you were able to put that on for such a what looked like an enormous group of nursing professionals in that room. So well done on that. Melanie.
Yeah, I also just wanted to reflect on the large number of service visits that I think the NEDs and the executives have been doing, which I know we get really good positive feedback from the services that we've been to, but it's also such a rich learning experience for us as non-executives, and helps to shape some of the challenge and holding to account, if you like, that we do in meetings such as this. I think also, as a group of NEDs, we've really got into a rhythm now of being able to write up our service visit notes and findings and circulate them as emails. And we normally will copy in the operations lead, Anne, or whoever it is, one of the execs, maybe, if we've accompanied with them. And those write-ups are really good in sharing the knowledge. So I think we're doing pretty well at that. And the other thing I just wanted to say was one particular event I attended this month, just gone, I think, was the Champions Network Day, which had been organised by HR and OD. We had the wellbeing champions, the mental health first aiders. Help me out, Chris. We had the diversity champions, I think, champions, and we had, and it was just a really, really positive event. These champions, for the large part, are just undertaking their role, really supporting the organisation, supporting particularly the well-being of staff across all of those different facets. It was the first time, I think, that we brought everyone together and had a bit of a learning and sort of just mixing and mingling day, and it was really successful. And I think it's one of more that might be planned in the future. But I just wanted to celebrate the role that our Champions Networks perform for this organisation. They just get on with it, and they really do carry messages both into and back from in a really, really valuable way. Thank you.
Thanks, Melanie. No, really good. I mean, I think it's really important to bring these things to life, and I would certainly, I would absolutely echo what you've said about the rich sort of sharing of experience from service visits, which has been happening behind the scenes. And actually, interestingly, I was actually going to highlight a couple of those because I'd read them quite recently. I think they're relevant to some of the discussions we're having at the board, and I think finding that opportunity actually to share some of the learning we've picked up from the service visits into the board meeting, I think, is really helpful. And I would encourage NEDs to do that. I'm sure execs would do that too, but there's been such a rich amount of sharing. I think it's really good to encourage that. So thank you. Chris, did you want to come in on the Champions the networking event?
Yeah, just I was there as well. I closed the event, and there was an awful lot of energy in the room, and people really showing their commitment and all across a broad range. And I think the different groups connecting in the meeting was another positive, because it's all slightly different functions, but seeing them all together, knowing they're all there, being able to share, and you know, the linkages in with the HROD team are able to link across them with equally Beth as the Freedom to Speak Up Guardian, I felt was incredibly positive. You know, and it just puts in a good space for taking messages out, involving people, and picking up on any issues that need to be addressed or people need to get involved with.
Great, thank you, and thanks Melanie for bringing that to our attention. Yeah, there's a table of all the activities that people undertake in the back of my report, and that includes all the activities that the NEDs undertake. And sometimes it is good to bring those to life, so not just a list of things. So thank you, Angela. Over to you then for your report.
I can see Saki.
Oh, Saki.
I was just going to say how enjoyable it was meeting the new governors, and it also there was a lady there that I'd met through the Reach network that was also following up. So one, seeing people in person is obviously always so nice, but also something that she was going to follow up with Chris in terms of I think I raised it at a board a few boards ago about the visa fees that people pay on a renewal. You know, the cost of bringing in new recruits from overseas versus the cost that people have to bear at the end of their 2 or 3 year term. So it was good to actually find the person, and now hopefully she's made contact with Chris.
Thanks, Saki. Good. Okay, Angela, over to you.
Thanks, Krishni. And just a few things I want to highlight. But again, to start, as always, with a big thank you to our staff, because we've seen examples even this morning. You know, we've talked about the champions, we've talked about urgent emergency care through Dave's update, we've talked about Swinfen Hall. But what we are very clear of is our staff are going above and beyond and are making a difference in all aspects across the trust, clinical and non-clinical, and we never take that for granted. So thank you to all staff for what they are doing, despite very challenging circumstances that many people deliver through. So just a few things I wanted to highlight. Again, on the theme of co-production, I think it's really encouraging that our liaison and diversion team have achieved that bronze status for the work with lived experience. So the co-production again is really important to highlight, and we know it makes a difference. So we're really encouraged by that achievement for them and encourage others to do more of that. The other thing to signal and highlight in the report is obviously the Northamptonshire SEND report. Clearly partners need to work together to obviously respond to that report, and I think just wanted to signal to board that as some of our key provision is through NHFT, we'll be working with partners very closely to support that through the commissioning of Northamptonshire Council, the Integrated Care Board, and obviously working together to do that. And the other thing just to highlight is that we've got our long service awards, which Krishni as chair leads. That's coming up in June, so looking forward to seeing staff and celebrating them through that experience as well. But I think that's all I was going to highlight for today. Thanks, Krishni.
Thanks, Angela. Any questions on Angela's report? No, okay, thank you. So just really, we were asked to consider the report and obviously note the updates on that. So thank you, Angela. We move on then to our operating plan and DigBQ strategy delivery plan, which was paper H. And I'll hand over to, I think Alison is, am I right in thinking Alison is leading this item? So over to you, Alison.
Thank you, Krishni. Okay, so we've got two papers in this report. There's H1 and H2. It sounds something to do with the new train line going up north. The first one is the annual update or the final annual update for 2023. So that's combined Q3 and Q4 report for the delivery of DigBQ. So I'll talk to that very briefly. I will assume that it's been read. Absolutely, it's impossible to pull out all of the excellent work that's been done and that the report reflects, but you can really see the significant progress that I think has been made over the year and the real difference that it's making to patients. So just sort of, if we turn it into numerical figures, 78% of all of our ambitions have been fully completed, just leaving 22% partially completed, but we have got actions in place to further progress delivery of those ambitions and actions in 24-25. I think just briefly to draw out some of the examples, I think it's excellent to see the partnership work that we've been doing in collaboration. So, for example, we've got the East Midlands Alliance report on the agenda today, so forward to take note of that and to be assured. Demonstrable progress made with our university colleagues in the partnership work there, and continuation of the work that Chris and his team are doing around making NHFT a really fabulous place to work. But more importantly, the quality initiatives that Linda leads through the improvement of outcomes for our patients. I think one final year to note as we move into the last year of DigBQ, and I think it's really reflective in response to the conversation we've just had around making sure that our risk scores really do reflect the progress that we're making and the mitigating action that we've got in place. So for next year, for the final year of DigBQ, we will be aligning the reporting of DigBQ to the board assurance framework, so we can really evidence that progress. So really, I'll pause there, but just ask the board to be assured and to note the progress that has been made before I move on to the next one.
Thank you, Alison. So there's probably just a couple of comments or questions. So first of all, Joanne, please.
Thanks very much, Alison. Just a reflection on the partnership section of the report, because there's lots of content around building plans and doing stuff. Could we just think about how we translate some of this into outcomes, what it means for our communities and for our service users? Because I think partnerships, the partnerships are obviously doing very well, but we need to see some sort of tangible connection to the people of Northamptonshire. Is that okay? Thank you.
Yeah, that's really helpful. Thank you.
Thanks.
Thank you, Alice. Thank you, Joanne. Sorry for the comment, and certainly perhaps that's just something to think about for the reporting going forward. Judith?
Thanks, Krishni. Alison, really great report. I just wanted to say thank you for including more detail around the impact, because I know that our last discussion that section was slightly thinner. So thank you for that. But I totally echo what Joanne has said. Even more, even more detail. Thank you very much.
Okay, and I guess just to come back on that and a note for reporting going forward, the work that we're doing, Richard's team as well, we're intending to include the National Outcome Framework measures in the report going forward, so we can really start to align and demonstrate where we're making an impact on patients.
Thank you. And Alison, just before you move on, I mean, interesting, Julia's not here, but I was reflecting on P1, which was the partnership with local authorities and our recovery and independence joint model. And I was going to bring up, which is sort of to Melanie's point, really, that Julia had recently been to the RIBU unit in April, and she'd actually shared some outcomes from her visit. So I really just wanted to highlight that, because it talked about, one of the things she reported back to us as colleagues was the multi-agency and multidisciplinary nature of the service and how it directly relates to NHFT priorities, vision and values. And having the service model supporting both admission avoidance and providing supported discharge from the acute environment, delivered by a mixture of different staff, social workers, social carers, nursing, OT and physio staff, and oversight of the model being undertaken jointly by the local authority and NHFT. I just thought, because that again, illustrating what we've heard on the paper with what Julia actually reported back to us from her visit. I thought was really helpful, and Jo also referenced that from her visit to Swinfen Hall as well previously. So thank you, Alison. I think at this stage, because this is the reflection back on Q3 and 4, you're really just asking us to approve the report and note the updates that you provided. And you are going to move on then to paper H2, I'm assuming.
I am, yes, thanks, Krishni. Okay, so the second part of this paper in your pack today is focusing on the year ahead, and it is and Dave may want to come in on this. It's our annual plan for the next year. This year's theme was supporting our communities, and it's a theme that recognises that while the demand on our services remains high, and the environment we're working in continues to be really challenging, it really does demonstrate our commitment to maintaining our collective focus on quality and patient safety and improving access to all of our services for everybody and for all ages and communities. It also reflects how we're going to respond to both national, local and trust strategic priorities. And it's presented in 3 parts. And I think the second part, if I start there, really talks to our operational plans and the patient-facing services. And then the third part focuses on those more behind the scenes enabling services that really do work hard to also support improvement of outcomes for patients and making NHFT a great place to work. So I'm not going to go into any more detail, and I don't know whether Dave wanted to add anything else, but the Trust Board's just asked to receive the 24-25 annual plan for approval, and just to be assured that its information during 24-25 through the quarterly reporting, which will, as we've said, be aligned to the board assurance framework going forward, will demonstrate our commitment and provide assurance throughout the year.
Thank you, Alison. Dave, did you want to come in before I bring colleagues in?
Yes, thanks, Krishna, and thanks, Alison, and thanks to the team for putting this together. Just a few contextual things. Just want people to remember planning guidance was exceptionally late this year, so to have turned material around, we also haven't got to a consolidated finance position. So I've taken the view with colleagues that that doesn't materially undermine what you have here at the board today in terms of planning. I think what is here is probably what we will have even when the resource money question is answered. Then 3 other bits. The ask for teams was to focus on place and try and begin to articulate plans that related to place and made a difference at that level, place being local area partnership. I think we're making steps towards it, but it's not entirely a revolution yet, but that will be part of the ongoing work over this year. The second was compassion. So could we bring compassion out in the plans that we were putting together for next year, both in the ways that we thought about designing services, but also reflecting on the patient story, integrating those kind of hope-orientated initiatives that kind of lift people and move the fabric of a society on. And the third bit that we focused on was on teams, really, and the nature of supporting them to support our communities. And that's the theme of the plan for this year. It's moved from recovering our services to now supporting our communities, and that's running through everything we do. So just those headlines. I hope what comes out is the so what, because beneath all of this is quite significant planning material in terms of delivery plans. What you're getting is a top cut of that, and we've tried to explain the so what difference we're going to make. We might not have got it right in all sections, but I think we've made a good start, and I hope you agree. So I commend the report and the plan, and look forward to feedback. You're mute, Krishna, sorry.
First microphone mistake of the day, apologies. Melanie, please.
Yeah, first of all, just to have pulled all this together in the limited time available is excellent, and it's a first-class document in terms of easily kind of reading and understanding. I just had 2 sort of comments really. I thought that in the introduction section there's a slide on community first, and And that's really where the social value sits, I think, but we don't actually use the term social value that I could find anywhere in the document. But there's that sort of economic value in that first section of employing local people, and then the environmental and sustainability plans. And my only sort of comment really was just making that a stronger sort of overall social value brand. I think it's something that people really understand the terminology of, and it might benefit us to really identify that. The other question I had was almost from my own perspective, and forgive me because it's probably there and maybe I'm just not picking up on it, but it was the link between our plan and the ICB plan or the ICS plan. And I kind of struggle to follow the threads of saying, and this part of our strategy supports that part of the ICS plan. Maybe it's not for this document. But I do think as a non-executive, I want to try and understand or maybe have it served to me slightly more clearly on a plate. It's probably what I'm actually saying, rather than having to look at the two documents and kind of weave it all in my head. You know, there are some really clear deliverables in the ICS that NHFT are part of delivering, and I couldn't see how those got drawn out of this. So I just think that would be helpful. And again, for people who are, for the public maybe, who are being confronted with a number of plans, getting that consistency and linkages, I think, might be helpful. So they were my only comments in what otherwise I think is a great document.
Thanks, Melanie. Dave, I'll perhaps take a few comments before we loop back round to you, if that's all right. I've sort of tried to make a note of the things that Melanie said, so we can maybe just prompt you to pick those up. But I won't take too many so that it becomes difficult to manage. Right, Rob, no, you next, please.
Thanks, Krishni. Alison, totally echo what Melanie says about the report. Really easily to read, and you know, for a strategy document to be easy to read is a real achievement. So congratulations to you and the team. I've got a couple of observations in relation to build, develop, and innovate. They're quite small. So under build, our green agenda is perhaps the area where we've achieved, we've not achieved as much as we wanted to last year. And I was just wondering, for the plan for this year, if you like, are we seeking to achieve what we could not get round to last year, or are we also sort of, you know, pushing the envelope a bit further? Under develop, it'd be great to understand a little bit, and this ties in with what Melanie said, it'd be really great to understand a little bit more about you know, health inequalities and how we're making a difference, and how that links in with ICB, because I know there is good stuff going on. I know I've spoken to a number of executive colleagues on this, and I know there's things going on, but I'm not sure it's clear to me exactly how it's brought together. And under innovate, I think we're sort of missing a little trick here under innovate. There is just so much work that our staff, our workforce is doing with regards to, you know, recognition of person-led service innovations, and I'm not sure that we're sort of even bringing that out as part of our strategy. So this is a tangential comment to the strategic document. But I just think it's really important to recognise all of that, and that be part of our strategy, if you like. That recognition around, you know, person-led service innovation is there. And yes, the ICB comment that Melanie made as well. Thank you very much.
Thank you. So there's quite a lot in there, Alison and Dave. So should we just maybe try and pick up the points that have already been made before we bring other colleagues in? So I think there was, first of all, something around just making sure we're really clear where that social value, where that sort of fits in, and whether we've adequately reflected that concept, inverted commas, into the document. I think perhaps linked to that, the green agenda, and you know, how much of the green agenda item is about delivery, health and equality. So if I can perhaps get you, Dave, maybe, yeah. If Alison wants to come in, just to comment on those to start with.
Thanks, Krishna and colleagues. I mean, on social value, I think what I heard, people could see it implied, but they couldn't see it called out. So I think that's a reasonable observation, and one we can look at. And important, I think, Melanie, as you say, to say the same thing the same way repeatedly. That's how you make it stick. So we can certainly get that back in there. Similarly on green agenda, just to call that out again, it's an implied set of things that we're working towards, but we can call that out clearer. In terms of the ICB plans, we do have these cross-referenced in the actual delivery plans that sit beneath this. I don't think it would be. I don't think that the 5 multi-impact interventions are CYP, older adults, mental health. I'm going to forget them, but they are broadly in there, but they're not referenced as being that. I think we can do that. I think we can say this is consistent with the focus on CYP from within the ICB. I think we can add that as a line. If you give me kind of authority to take that away without necessarily taking the report back, that's not a problem. Again, on health inequalities, we can make that a bit more focused. In fact, hearing the feedback, perhaps we just need to add actually potentially something in the enablers that just picks that up a bit clearer. We did touch on it a bit as part of the sustainability work, but I'll take that away. We will do something a bit more focused on inequalities just to kind of close that off. So changes then that I'm proposing and hoping you'll delegate to me to close off. Greater clarity on the social value elements where they exist, clearer reference to the green agenda and our commitment to it, a cross reference to the ICB plans, which we know, and as I say, the material is in there, but we can say this relates to the ICB work on X, Y, Z. And we will do a section on health inequalities, which would be an additional piece in the document to close that off. So those are good observations, and thank you for allowing us to take it through board on the nature of the pace we've tried to be run at to get things landed within a timescale. So for members of the public, I hope they also accept that as part of our iterative approach to getting this right in a complex planning round.
Thank you, Dave. I think that's really helpful, and particularly possibly that cross-referencing to the ICB 5 high impact actions that were agreed across the system makes it a sort of the cross-referencing probably more straightforward, really. So that would be really helpful. And if I may, just to add on the health inequalities piece, I think there's just something about, and this is not about the document itself, just thinking about how we bring our work on health inequalities to life at the board, perhaps through the reporting on this, perhaps through something else. I feel that that's slightly not something I feel like we're talking about enough at the board. So it's just thinking not about the document itself, Dave, but just how do we make sure we're evidencing in the board meeting that those things are being, the work we're doing, because I think the work is being done, and you did reference that as well. Is that okay? So that's less about the document, but I think I'm sure colleagues would be happy to delegate the further development of the document to you on that basis. And there might be other things as well. Dave, did you want to come back in?
Just on the inequality, I do think I'll pick it up with Richard, because there's been a few things where we've thought, actually, the way to nail this down culturally is to have it in board cover sheets that people have to reference, a commentary about how it addresses our inequality agenda, how it addresses our work around Together Against Racism, all of those key strategic pieces. So I do think a little additional bit of governance in terms of what we're asking for people when they complete boards will help with that, because the work is happening.
Yeah, we just need to evidence it. I think and that's a really good way. I welcome that. So thank you. I think that implementing that would really help to reinforce that and the importance of the work we're doing. Robin, please.
Thank you for the paper, Alison and colleagues. I mean, it is a big, ambitious, aspirational document. And I think we should be very proud of being so assertive as a statement of where we want to be as a trust and where we're going. So I think there's a lot of very good things in here. But I just wanted to loop back to Joanne's point that she made about the reporting on it on the last paper, is that I know it's a strategic document, but I did feel slightly unclear clear about how we're going to really monitor the progress that we make against these aspirational aims. And just to pick out the health inequalities angle as just one bit, you know, there's some very, very warm words about how we're going to do it. We're going to do this. We're going to achieve these things, but it's very unclear about how we're going to monitor, measure, and report on that. And I'd like to see far more within it about how we are going to do so, using data sets or whatever else there is in terms of corroborative information, so that we can see there has been progress made. So it's the same point that Joanne made earlier, but I think we need to see some of that in this bit as well.
Thank you, Robin. Again, I'll just take a few comments before I hand back to Alison or Dave. Joanne?
Thank you, Dave. Yes, your so what bit comes through really strongly, which is great, because I'm a bit of a crack record on that. Health inequalities, I feel assured, given your response on that. The two other bits that I apologise because I keep saying the same thing is the whole themes around prevention. Where are we saying that we will help our communities, and it may be the build section, to be resilient and, you know, head off some of the crises that we see happening now. And I think there's a secondary strand which is more of a sub theme, which is that whole thing of accepting that there are still waiting lists and we're doing our best to deal with them. Do we have something around waiting well? You know, how we use the waiting period to help people in other ways. So those are my two comments. But again, congratulations on such a good document in such a short time. Thank you.
Thank you, Joe. Dave, do you want to come back in on either of those?
Again,
I'm putting you in the hot seat repeatedly rather than Alison, but Alison, you're welcome to comment. But
I'm very grateful, Krishni. I'm very grateful. Please carry on.
They're all great observations. I mean, what this board isn't seeing is the quite detailed delivery plan underneath this, which is an 80-page, almost 100-page kind of document of significant detail. So what you are highlighting, though, is there are some things that as a minimum you would expect to see in a front public-facing document like this. Those things are easy to change, and I'm asking you to delegate that for me to do so, and then we'll make it live. On Robin's reporting, David has some thoughts on this, Robin. So if I might, what I'll do is we will prep a paper for a performance committee detailing how we're going to report against the delivery plan, because obviously we had a framework last year which Alison has just talked through in terms of specific elements of the plan from last year. I know David has views about how we might approach that for next year, which I can't, it's just not on the tip of my tongue to convey
I can help
that.
if you like, Dave.
You can do that, Alison. Okay, great.
Yeah, I can help very quickly. Okay, so Robin, yes, absolutely. We're looking at how we're going to report on this next year. We've already sort of alluded to the fact that we are going to include the National Outcome Framework measures, so the NOF measures, which will really start to give us some hard figures to that quantitative data that you're looking for. I think also we're going to make sure that when we're looking at the reporting, it is that the reports and the assurance are going to sort of run through the organisation, like through our governance, like a stick of rock. So the relevant component parts of the DBQ plan will go to the relevant committees. So, for example, the piece around finance, value programme, sustainability will go to the performance committee. Anything related to quality will go through Linda's quality and safety committee. So we will do that really detailed analysis and in-depth discussion assurance in that space, so we can assure upwards to the board going forward. And I think working with Richard's team, making sure we get the governance around that right, will be really, really important. But absolutely take on board what you're saying in terms of we really do need to make sure that we're demonstrating where we're improving those improving outcomes for patients and for our workforce as well.
Brilliant, thanks, Alison. So a combination, I think, of Dave's comment from just before Alison spoke, that perhaps just something that goes to performance, just fitting that outline out or confirming that, I think would be really helpful, Dave, if that's okay. And you were planning on doing that anyway. Sounds like that would be helpful. But from what I've heard, obviously a lot of thought has already gone into that. So it's just important to recognise that, and we can take it forward on that basis. So final comments then from Tim and Saki, please, Tim.
Yeah, mine's just about the language, actually. It's a really good report. Well done, guys, pulling it together. I think it's excellent. My only comment is that in the welcome pack, welcome of it, and then in Dave's forward in it, and interestingly in his verbal introduction now he talked about recovery of core services, but actually it kind of tails off on that everywhere else in the report after it, and we kind of then focus on the new and the shiny. And I think if I was a patient listening to or reading this, I'd want to know, are we getting our core services back on track and how are we doing it? It's just an observation about how the narrative of the pack runs through, that's all.
Okay, thank you, Tim. Saqib?
Yeah, it was just a thought, that joint workshop we had with LPT, where we talked about bringing kind of eventually, well, not merging, but using more common language and deciding how we move forwards as a group, rather than obviously whilst still two sovereign bodies, how that was coming along, because obviously that, along with the ICB at a local level, will have an influence at, you know, how this eventually transpires for 24-25, notwithstanding the financial envelope and everything that we're doing, DigBQ at a local, NHFT.
Thanks, Saqib. Dave or Alison, any final comments? So I think there was just something about Tim's comment about recovery and being clear that we're still, you know, there is some recovery of services still going through our plans, and then that broader point about the group contribution.
Yeah, again, astute observations, and I'm not hiding behind the detail that's in our 80+ delivery plan at the back end, but it does pick up on a lot of that. But when we do the wash through, Tim, with the other elements, where do we see an obvious opportunity to re-emphasize that for our communities and to illustrate for them? We will try and include it. So that's our commitment to you. So other than that, thank you for feedback. Thank you for allowing us to take it in an iterative way to board. We will take that away and we're in month 2 now, so I've got to get going on it. We will take something through the performance committee just in terms of updates and reporting, bearing in mind quite a lot of what you might see will be in the IOR anyway, or should be popping up in the narrative around that, because that is the thing that picks up our performance and our deliverables. Yeah, the team would be really pleased with the feedback, actually, because it's been a really difficult year. People really ambiguous rather, with people waiting for guidance and uncertainty about money and so on and so forth. So for them to have produced a product like this and to get feedback from you as you've given will be really appreciated. So thank you.
Thank you, Dave. And just to reinforce, sorry, Alison, do you want to come in as well?
Just if I may, Krishna, I was just going to sort of respond to Alice's question around the group work and where we're going with that. Just to say, I've literally just come from a meeting first thing this morning, starting to look at the planning for the next phase of group strategic framework that has been discussed by the group, and how we're supporting that and how we're starting to develop and think about that common language and our shared objectives across both organisations, but still really retaining our individual organisational identities and sovereignty, which is important to everybody. So there will be more progress reports on that going forward, but just to assure you that works in train, and it's really useful to hear this feedback today, because obviously we can take that forward in the next iteration of our group strategic framework, and build on it. So it's a really fabulous opportunity to be able to listen and to be here today to hear feedback verbatim.
Great, thanks, Alison, and thanks for leading on those two, and thank you to Dave also for sort of actively contributing and outlining how we will address some of those things. So a couple of key points that you know, that lots of rich feedback, but please do take on board. I think that this, you know, it's a great document. So I think, you know, recognizing that is really important. It's a great document. It sets, I think it feels very NHFT, if I may say that, because there's something in the way it feels, not just in what the content is, that felt, you know, really positive, aspirational, as Robin and others have said. So really important document, a really great first, you know, submission to the board. We're delegating to you, Dave, to take that away, I think, and work on it as you've said, and along with David, obviously, and we look forward to kind of hearing more about the monitoring arrangements, which you said you would do via performance. So is that okay? Thank you very much. Super. I think it's important to allow us to have a good discussion about that because it's part of obviously our focus for the coming year. We now move on to the East Midlands Alliance Common Board paper. Alison, this, in the interest of time, perhaps we can take this paper as read, but if there's anything you particularly want to highlight, then please do, and then we can just open it up for some questions.
No, I think, Krishna, you're absolutely right. Interest of time, I'll assume that it has been read. I think it's just a fabulous report to read. It gives us huge confidence and assurance around the work that's happening across the East Midlands Alliance and demonstrates the benefits of wider collaborative working, and the progress that we can make is, I think, significantly impacted by working together. So, no, just for the board to know and to be assured of the work that's happening.
Thank you, Alison. Melanie?
Yeah, well, I just want to echo, first of all, Alison's comments about just how valuable and positive this alliance is continuously becoming, the breadth and depth of discussion, clear impact on patient care, quality of patient care, but also the delivery and some of the operational obstacles that the alliance is challenging is absolutely clear. I guess as I read this, my question sort of came around. I think I'm losing track of the work that the Alliance does and how that is coming back into NHFT, either at a committee or a board level, to understand maybe, aside from just getting a sort of a joint update paper. And there were some things that the Alliance was doing, and I just thought, oh, have I seen that in terms of from NHFT's perspective? And I'm famous for forgetting things that I've seen in previous committees and boards, so do take what I'm saying as potentially you're about to tell me, yes, we did that and such. But I was thinking about the review of the regional collaboratives. The Alliance Board had commissioned a review of the functioning of the specialist collaboratives from the viewpoint of partner providers. And I was thinking, gosh, that sounds really interesting. Did we see that as NHFT to understand some of the impact for NHFT in that? So I'm not going to go through every one, but I just thought there are some things maybe that the Alliance is doing that would be really interesting and important maybe to understand the impact on NHFT of those elements. I am certainly not looking to add in a huge amount of additional paperwork or reporting, but I do think there are some things at a point when maybe the perspective in a committee or informing a committee of some of the detail might be useful and helpful. And from a sort of organizational governance perspective, maybe there should be, for a couple of things, a little bit more insight shared at the time, if you like, with the relevant committee or board. I don't know.
Thanks, Melanie. I think Richard's put his hand up to talk about that because there are several things that we've put in place that I think happened probably about a year or 18 months ago in terms of putting a commissioning committee together, didn't we? But I can bring Richard in to explain that. Angela?
Yes, no, thanks. I think just to sort of frame a few things for people, obviously the Common Board paper is about the Alliance and there's many things within that. I think Richard will describe the sort of collaboratives and the governance around the commissioning committee as Christian has described. I think the other thing I would just say is that the paper and the work that goes to the strategic exec so that all directors can pick it up, because obviously in the past we've picked this up through strategy or myself, but actually it's relevant to all directors in their portfolios, and they should be taking things through as relevant through different elements. So it might get reflected in Linda's quality report, might get reflected in something that ITI is doing in medical directors. It just depends where the relevance sits. But I think it's helpful just to remind us of, are we doing that sufficient? I think Richard will come in on that one, but it's taking many different routes now, Melanie. I think that's the important thing to signal. I think what you're also saying is doing a lot of work, and I would agree with that. And I would also just pull out the fact that through the Alliance, because we're attracting resources, that's helping us significantly, which I think the board is cited on. And we are going to continue to focus on patient safety programme, which a lot of areas are not choosing to do, but we're taking that forward. And I think that's really important in this current context. So, but I think the governance route, Richard can comment further on. Thank you.
Thank you, Angela. Richard?
Thanks very much. Yes, we've sort of alluded to it in the preceding discussion, but just to confirm that we have a collaborative and commissioning committee which formally reports to the performance committee and therefore onward to the board. What we are also doing is ensuring that any relevant quality matters are being brought to the attention of the Quality and Safety Committee as well. And as Angela mentioned, there's quite a substantive regular discussion at the Strategic Executive Board on the management aspects of that. That said, I think it is worth us taking the opportunity through the annual effectiveness review, which is of course later on our agenda, given the evolution of the East Midlands Alliance. And as you mentioned, Melanie, it's greater significance perhaps than before. Have we got that balance right? Are we seeing enough? And indeed, is there an opportunity to cover more in, say, development workshops? I think these are all useful questions to ask ourselves. So I would suggest through that mechanism, which we'll discuss later on, we can perhaps explore that some more. Thank you.
Thank you. And probably also what I would sort of, bearing in mind that obviously, quite rightly, not all of us attend all the different committees, that actually it's helpful for us to think about what other NEDs who don't attend those committees need to know emerging. So the AAA is a positive opportunity, I think, to highlight work that might be reported in terms of collaboratives, and being really clear about that, I think might be helpful as well. So just I think a few reflections there, but certainly we can. I think Richard makes a really good point about picking, obviously getting any feedback through our annual effectiveness review process, but also thinking about perhaps another, a further development session that also helps us to come together to talk about the different collaboratives and where we are in terms of impact from each of them. I'd certainly want to reinforce really that, actually, in a different context, I received a presentation, not as NHFT chair, but in a different context, I received a presentation that actually was a review of the learning from collaboratives such as the East Midlands Alliance, and why it had been so successful. So that was an independent or semi-independent piece of research that was commissioned and involved one of the universities. And there was some really rich learning, actually, which I think is about translating the learning from the way that why these collaboratives have been successful, and particularly the East Midlands Alliance, but others as well. And just to share with you, one of the key features was about psychological safety and how that is important in a collaborative setting. And I thought that was incredibly powerful, because people don't often think about those things. They think about the structural pieces like MOUs and things like that, but actually creating a team of teams is the term that actually came across to me really powerfully, and to other colleagues who were part of that really is, it doesn't matter who the members are, but creating a team of teams in whatever collaborative environment you're trying to generate or create the conditions for, felt like a really important learning. So I just wanted to share that. But thank you, Alison, for the report. It is obviously a common report that goes to all the boards, so we're all cited to the same level in terms of content. And at this stage, it's just for us to note and to support really the recommendations from the review, and just note the progress. So thank you. Okay, and we'll certainly take away, I think, making sure we have perhaps a further opportunity to look at it through the board development programme. I think I will just try and cover paper J, and then we'll go to our break. We're running a little bit late, but I think we can afford to take paper J perhaps before we stop. So this is the Integrated Care Board's 5-year annual plan refresh, and it is for our noting. But Alison, is there anything you wanted to particularly highlight?
Thank you, Krishna. Just very, very briefly, is just to reference the fact it has already been approved by the ICB, but it's only here as for information. as being a member of that organisation, we're a partner of that group. I think it's important as well just to and reflect on some of the comments earlier, just the language in this paper and that is in our DBQ report is different, but we can really pull out some of those synergies where we're working in partnership and making a difference. So, for example, CYP, children and young people's access to health and social care, across mental health and the community services. We talked about inequalities and social economic development through the social value programme. I think we just need to make that stronger, as we've all reflected on in the DBQ paper. But no, it's just merely here for information for people, for the board to note.
Thank you, Alison. So it would have obviously gone through the committees of the ICB, of which certainly we have NED colleagues on those, and of course, as we say, been approved by the ICB itself, of which Angela is a voting member. And to be clear, I think these plans, ICB plans, also have a requirement, obviously, to meet certain expectations in terms of what's covered in them. And this is a refresh of the joint forward plan, which was all ICBs were required to do. And I think it's just helpful to bring to the board's attention the multiple impact interventions that were agreed by all partners, and I think co-produced. Dave, I remember even being part of a workshop with you some months ago about what we might include within this. So partners were involved in that process. So important just to highlight that. Joe.
Thank you. It's just really a comment, Dave, Alison, to reflect on, which is the ICN strategy and our strategy. There's a bit of a gap on that place theme. So just in terms of how our communities understand it, just how the place agenda gets played through. There's no reference to local area partnerships or indeed the sort of health and wellbeing board structures. It may not be an issue, but just to say, coming at it with fresh eyes from the point of view of just an ordinary member of the public, it would be quite hard to understand that place element.
Thanks, Joe. Melanie, I don't know whether that's just something you can feed back to IPRC, because I guess IPRC is a place where that might be appropriately picked up. So just because interestingly, we included the sort of structure within our document, but that same structure wasn't reflected in there. So perhaps just in terms of the monitoring and the communication, now that it's formally approved, actually that IPRC could just reflect on how that's brought to life as part of reporting. Melanie, does that sound okay?
Yes, I was only going to say, sorry, there were a number of comments that were made during the discussion about the plan. Obviously, the discussion at the last IPRC was before the national guidance was published. So again, it was a sort of a best guesstimate. And there was a number of things discussed. I don't think the document that we've got in front of us as a summary was intended to replicate how then all of those activities disseminated out across the various structures available. And that's probably, Joanne, why place doesn't get a specific sort of reference in terms of that. But I will take that comment back and I will reflect it in the next meeting, which is week after next. Okay.
Great. Thank you. Thanks very much. So that's here for our, I think important to share with colleagues who might be looking at our board papers that we've received that and we note that plan, which is obviously important context for our delivery of our own plan. Thank you, everyone. That's been a very comprehensive discussion on a number of things on the items we've covered so far. I think we deserve a break. Come back, everybody. We'll make a start on the remainder of our public board agenda. So we move on to talking about our performance, integrated performance, and we start with our alert, advise and assure report from the performance committee, and over to Judith as chair of that, please.
Thank you, Krishni. I will take the report as read. just a few points I do want to highlight. As for IAC, there are no items under advice, which is really quite excellent. However, there is in fact an item under celebrating outstanding, and that was at the financial performance of month 12. The committee really wanted to recognise the hard work that it took for not just the finance team, but the entire organisation, and especially within the context of the challenges faced by Northamptonshire as a system, to actually deliver the agreed target for the end of the year. So just wanted to really highlight that and thank you for and thank everybody involved in that. In relation to Assure, we received the integrated organisation report, which is always much discussed at the committee. And there was extended discussion in relation to how the report can actually be brought into the next stage of maturity, to allow the committee and also the board to triangulate between issues, consider cause and effect, and do a little bit of horizon scanning in relation to the data that is being reported. And that's something that is part of the integrated organisational report, which follows this agenda item. Under the Group Value Transformation Programme, the committee received the first report for this initiative. It's a really clear report around, and it gives a lot of assurance, especially around governance and the existing work that's been done. So we look forward to receiving further update on this very important initiative. The committee also received the operating planning work for our annual planning round update, and there was quite a lot of discussion around need to focus on health inequalities, environmental sustainability and prevention. And again, we're looking forward to seeing more on that under our social value element of our strategy. I'm happy to announce that we have agreed the contents of our performance committee workshops, and we also have dates for them. And finally, just to tie in with something that Melanie raised earlier, we did receive the AAA assurance report from the Collaborative and Commissioning Committee, introducing the AAA reports to both this committee and a number of other committees that report up to performance committees, a new initiative, and it's very welcome. But it has also highlighted the need to look at the governance arrangements around that committee, and also as to how the performance committee itself can actually add value to the information that is presented to it. So that's I'm just sort of almost a little marker in the sand that that's an ongoing work in progress, and I will of course be reporting into the board on the development of that on an ongoing basis. I'm really happy to answer any questions, but this is really where I wanted to just leave the report.
Thank you, Judith. And actually helpful there, I think that indeed the Performance Committee and Judith's report was actually suggesting there the point that we picked up in our earlier conversation about the collaboratives being a focus of the future board development workshop. So, so we've already agreed that we would take that forward. So I think that's a really helpful alignment. And actually, a comment from me. Obviously, welcome any other comments, but really a helpful report. Thank you, Judith. I just wanted to pick up the point that I saw. The committee were assured that there was work being carried out on the social value element of the NHFT strategy, which is relevant to these areas, and work will become more visible over the coming months. I thought that was helpful because I think that will be important again. We've talked about social value to governors. I think it really helps with the sort of broader aim, the economic well-being sort of part of the integrated care strategy and the ICN more generally. So, and then I think I read, Dave, in your integrated organisational report paper that you were intending to report more on the social value piece as part of that. So I thought that was helpful to note as well. Any other comments that anyone wants to make before we move on to the actual paper L, which is the latest integrated organisational report? Okay, thank you. Thank you very much, Judith. So, Dave, over to you.
Thanks, Krishni. And just on social value, we did have a roundtable with LPT on social value that I convened, and it was really well received. And we've got a community of practice now emerging across the two organisations to help drive that. I suspect Alison might want to come in on that.
You said exactly what I was going to say, David. Just to note that the social value community of practice that will be going in the diaries very, very soon. They're going to be quarterly meetings, and we're pulling together a programme of work with that community of practice in partnership with LPT. And we are also looking to use the national outcome measures, they're called TOMs, for social value, to report on our social value progress going forward, and hoping that it will become a component part of our annual report starting next year.
Yeah, thanks, Alison. So good work in progress. So just on the IOR, Krishna, I'll take it that people have read it. I'll just draw out three things. One is the SEND inspections have now been confirmed for North and West, and reports have been received. And the ICB development session 2 weeks ago had a session on that, looking at the emerging governance for how the improvements are going to be driven across the system. There will be 2 improvement boards. They will be independently chaired. So quite a significant bit of architecture moving into the system to begin to now grip the detail of children and young people's services and experience in SEND more generally. So that is positive, and I mentioned that specifically because our community PEDS is still not managing to meet its target level of activity, and that has a material impact on the discussions that we're having as part of SEND. There is work happening to do a community paediatric review, which did land but has now been withdrawn and is being redrafted for reasons that are relevant, but I won't go into here. So I think once that concludes, we will then have a clear line of sight about, as a system, how we're approaching community paediatrics more generally. It is a shared service across the county, and one that we're really keen to get recovery plans, concrete recovery plans as a system in place. The second thing I just wanted to draw out was related to MSK, and you will recall post-COVID, this proved to be one of our most intractable service areas. There was issues with access to gyms that had been repurposed during COVID and so on. I'm pleased to say that we're now at the highest level of performance since January 2022, which again is really positive news for people that have been waiting on those services. And we have an extensive, back to the earlier conversation about waiting well, we do have an extensive programme of waiting well for our children and young people's pathways, for MSK pathways, etc. So we have really become quite expert at exploring innovative ways of supporting people, and that's really, really positive. So just to call that as a highlight, and hopefully that will continue. The thing I think that's making the difference here is the really hyper-focused work that we do through our new programme groups. So the adult programme group and children programme group, we're able to really get teams around an issue and drive improvement. So that's been really positive. And then also to finish on a positive, well, I'll end with a positive, but just in terms of Marine Award, you'll recall that it's our PICU unit that we're refurbishing, that is having a material impact on our out of area activity. So when you see the numbers, you know, we've taken a PICU out, that means we have to move patients elsewhere. So the numbers reflect that in out of area, and also the finances reflect that, because of course that is a cost pressure for us, which unfortunately is just unavoidable considering the dilapidated state that the facility was in. And then finally, ICT, continue back to our urgent care conversation, continue to support the system with performance well above the expected 70% at 80%. And the reason that's really important is it supports pressures in the system in A&E. So back to our helping services recover, it gives headroom to services to recover. It means real difference to people's outcomes in terms of their experience of care, because we're getting to them quickly at home. And it is a critical part of our infrastructure and contribution to the wider urgent care system in NHFT. And we've done some great stuff with taking 111 calls off EMAS and real great partnership work. So just to call that out as an example of supporting our communities being the theme of planning. We do it every day in some of these services, and we're building on it. Thanks, Krishni.
Thank you, Dave. Any questions or comments for Dave? Angela?
As ever, I think really helpful report in terms of the trust position. I think it's just a reminder for Quality Safety Committee just to make sure that where we've got headline figures like, for example, mandatory training, supervision or appraisal, that headlines beyond that, so at directorate level and within core services, are examined, because that can be different and needs to be understood in that committee. That may be happening for regular basis, but I just think it's important just to remind people that is really important. Thank you.
Thank you, Angela. Can we make sure that's being picked up then as a part of the considerations? Joe, please.
Thank you. Dave, just a sort of point of detail. Obviously, the waiting list figures, there's some good news and some not so good news. Is there a separation for those who are waiting for initial assessments and those who are waiting for treatment? Is that something that we perhaps need to maybe get performance committee to have a look at? Just, you know, again so the board can have some assurance about how that waiting well is being prioritised.
Yeah, and the NHFT, the new oversight framework line on waiting lists would pick this up, Joanne. So it asks us to come at waiting lists from all ends, so from long waits and those that have just joined who might be waiting for an assessment.
Okay.
Going onto a pathway. So we have got a version of the NHFT which I haven't brought through into this pack. No, it'll go through to performance committee pack.
Okay.
The first cut of that.
Okay, that's excellent. Thank you very much.
Great, thank you. Melanie?
Yes, thank you. I actually had a question about Marine Award, and you mentioned it, Dave, in terms of the cost and disruption that's driving. No doubt as well, an impact on patients who are going out of area, the families, etc. I remember monitoring all of the Section 136 refurbishment work through the Mental Health and Legislative Committee. I'm not quite sure whether it's in Performance Committee that the progress on the Marina refurb is just being monitored. I know we had an awful lot of problems caused by all sorts of things, including COVID back in the day, on the Section 136. So I just wondered whether we had a clear delivery date for the Marina refurb and whether we are on plan with that, because clearly it's costing us in all sorts of ways to have that ward still closed.
It's feeding through in reporting terms to Seb currently, but right. What I'll do is I'll get a line from Paul when he's back in terms of where we've got to with contractors on completion date, just to give you that reassurance. I agree. I think we'll keep an eye on.
Thank you.
Okay, thank you. So if we can note that as an action to be taken, just to provide that update in Paul's absence, that would be great. And a quick couple from me actually, Dave. One was really helpful. It's a really helpful report as ever, and so enjoyed sort of reading through it. And obviously that, you know, there are positives and challenges that we all recognise. I was just interested. We talk about the harm review process, which obviously is, you know, absolutely, you know, critical in terms of prioritising people by clinical need. I just wondered, Dave, whether we're thinking about health inequalities when we do the prioritisation. I'm just conscious that increasingly when we're talking about acute waiting lists, particularly acute electives, there's been a bit more of a focus on how do we build in, you know, not clinical priorities are obviously really important, but is there even further prioritisation that can be done in relation to inequalities or potential for exacerbating health inequalities? I just wondered if that's something we have thought about or can think about as part of our harm review processes.
I'll bring in Linda and Itai for me. The short answer is yes, but with lots more to do. So the MAS tool, which is the acronym's gone out of my head. Somebody might be able to find it while I'm trying to work my way through this answer. The MAS tool that we use for segmenting waiting lists in community mental health care does pick up ethnicity and begin to cross-code people against specific characteristics. The thing that will make the difference for us now as a trust is that we have finally cleaned our ethnicity coding. So we are now using the proper data set. That was the major limiting factor for us in being able to do the segmentation that we're describing. Whether we get to a point where we do what's been proposed, I can't remember who's proposing it, in terms of an index of, you know, people would be allocated a kind of a score essentially based on need, deprivation, kind of life chances, etc. I think we will look at it for sure and see what the emerging evidence says. I think there are pros and cons of it because it does create a cycle of potential perverse opportunities. So it needs to be thought through carefully. But may I just draw in Linda and Itai specifically in terms of harm reviews and the way that we look at people's wider needs as part of that?
Thanks, David. Yeah, thank you for that. I think we've started to make progress on this work, and certainly we're involved in areas of work through mental health. And I know Wayne was leading one of those work streams. So we've started to look at that. We also know through the work we're doing around our PCREF will strengthen us actually monitoring that ethnicity and actually getting firsthand feedback from those particular groups with those characteristics. So it is something that, you're right, David, that now that we're starting to record it correctly, we'll be able to present that information for us to be able to review and discuss.
Great, thank you. Yes, of course, the connection to PCREF is very important. Thank you for reminding us of that, Linda. So thank you. So at this stage, I think, David, just asking us to note the report and obviously the performance areas and risks associated, which we do. So thank you for the comprehensive report. We move on to our quality section now. So first and foremost, we have the assurance report, the AAA report from the Quality and Safety Committee. And in Julia's absence, it's over to you, Robin.
Thank you, Krishni. Obviously, as usual, take this as read. I want to pick out three things from this report. One, to know there's nothing from approve or alert, which is good news. Then in terms of the advise items, the one I will pick out is the key line of inquiry issue that was raised in relation to the letter from the local medical committee to the Integrated Care Board about issues about expectations on GPs and their concerns about not always picking up referrals that come from trusts, etc. So this is a matter that will need to be carefully kept under review. It went to the ICB Quality Committee as well and was a substantive item for discussion at that when it met 2 weeks ago. We don't fully know the implications yet for the trust, but it will be one that we will need to keep in very close contact with GP providers and the ICB to monitor any impact that then falls to the trust. So picking up the other two items, one was from the Assure and one, in fact, again, was from the Celebration. In terms of the Assure, and this relates back partly to some of the things that Dave was saying just now, there's a really positive story about management of pressure ulcers that emerges in terms of a new way of managing new issues as they emerge. So there's a new system being created whereby instead of just taking it a handover, there's much more ownership and leadership of this from senior managers. This multidisciplinary team meetings occurring 3 times a week, which are really making an impact upon the numbers of new pressure ulcer incidents awaiting review. So this is a really positive story of reorganization of service to deliver measurable improvements for patients in terms of outcomes. So I think this is well worth celebrating and or mentioning. We have another one which is equally worth referring to, which is under the Celebrating one, and it again relates back as said, to waiting list management, and this is in relation to the MSK physio service, which has dramatically reduced the waiting list by much more efficient management of that list and review to ensure that some of the people who really didn't need as much attention, were just sitting on the waiting list, really can be managed in a more effective way. So this was, we thought, a very impressive piece of work which deserves celebration. So those are the three things that I'd like to highlight.
Thank you very much, Robin. Any questions or comments on the report? No, but a thumbs up, I think, on the points made, Robin. And I think it's really good, isn't it, to see examples of, you know, recognizing the challenges of waiting lists. I think this is now, you know, several examples of people actually proactively trying to find ways of changing processes, etc., to really improve that. And I think that's really important. We heard previously in a patient story, we heard from the it was the older adults team, I think, in Rushden, who talked about the work they'd done, Farida and Nancy and colleagues, about the work they'd done to really address sort of waiting times. I think it was for the memory assessment service, if I remember correctly. So it's really good to see that, and I think the learning, sharing that learning, so that we can really make sure every team is taking that opportunity, I think is you know, really important, and that's highlighted in the report as well. So thank you. Itai, I think you wanted to come in.
Yes, I just wanted to comment on the letter from the LMC, which was sent to the ICB and was obviously responded to by Toby Sanders. There is a piece of work going on which is convening medical leaders from, you know, primary and secondary care, including some of you know, GP leaders and reps from LMC. I think a lot of the things that, you know, the GPs had initially, you know, stated that they would stop doing would have had some implications for, you know, quality and safety. And I think there are more constructive, you know, conversations taking place now about how, you know, some of those kind of unilateral blanket, you know, changes to practice may have an impact on patients and how those need to be modified. And I think there's some agreement about a way forward, but this is an ongoing piece of work, you know, which will not have some easy solutions in the short term, but you know, we're working through in the background. The majority of things that we considered would be of risk to NHFT, you know, are in hand and under control. And certainly, you know, patient safety is at, you know, the center of, you know, some of the negotiations we're having.
Thank you, Itai. Helpful addition to our understanding of that issue, I think. So we note the report. Thank you, Robin, for the update. Move on to first of all, the patient safety and learning assurance report. So Linda Papero, over to you.
Thank you, Chair. I will take the report as read. It is quite a long and detailed report. Some information provided.
Sorry.
On
Sorry, Linda, just to confuse members of the public, I said it was paper O, but it's actually paper N. So just to be absolutely clear, apologies.
Okay, thanks for that. So we've included the top 5 patient safety issues that have been raised, with the note that treatment has now come up and flagged, and a lot of this is down to the restraint to feed cases. We had some discussion around that in Quality and Safety Committee and how that could then be broken down so that it's really clear what we are talking about when we talk about the restraint to feed, and there's clear understanding on what that intervention is and why we then report it through our DATIX incident system. So we provided some information on that. Robin has already alluded to our management and review of pressure ulcers. So we've got the part where practitioners are going through those and making sure that all patients are allocated, reviewed, and assessments are in place. Unfortunately, we will have pressure ulcers that have occurred whilst patients are receiving NHFT care. So that's new to us. And this is the meeting that I chair. So we are doing this on a fortnightly basis where we're looking at the immediate actions we can put in place, identifying ways that we could prevent so that not other patients are going through similar situations. And then the actions are immediately carried out whilst it then goes through our usual process with our review of significant events. But at least we've started to pick out the preventative and also the immediate actions that we need to put in place. So that process is now taking place. We are embedding it into practice. And so far, reporting from April, we've been able to have those meetings consistently. Also contained within this report that I did want to highlight to board was on our emerging themes risks that we've articulated within the paper. And one risk that we've been reporting is around the allocation of investigations. So there's various reasons why we've got some investigations not allocated. I had a conversation with Julia Curtis, Chair of Quality and Safety Committee, around this, and she did actually ask that we provide more information than what we'd previously provided around this. One of the key things around us allocating investigators to these cases is that we do need someone who's got the required level of skill knowledge for that specific incident. And we always ensure that we engage the family or patient as much as possible, because we do want the voice of the patient family to be included within this. And unfortunately, at times, patient or family might not be able to engage with us immediately, which means we've allocated it when they're ready to engage for us to progress. The investigator has since moved on to other things. So those things come into play. We've not had any duty of candor breaches for the period that we're reporting, and certainly we continue to monitor that position effectively. I do want to make mention that as we've moved to the PSIRF, which is our Patient Safety Incident Response Framework, we'll start to see a reduction in the number of incidents that we're looking to investigate. And that just means to say that where there's similar trends, we wouldn't then automatically carry out an investigation, but we would still engage the patient, the family, and we would still look into the review of those incidents, but it would not carry out the previous system that we had. So you will note that we are currently still reporting on both, which is our patient safety incidents, as well as the SIs, until we've reached the end of our serious incidents. So we'll continue to report them in that format. I can also confirm that the numbers we have of unallocated investigations is a reduction to what we previously reported at the same time last year, and also from the period we reported when we started reporting this in 2022, and we'll be able to take that information to the next Quality and Safety Committee so that they can have a review of that information, which has not been articulated within this paper. The last thing that I did want to signpost board to is right at the end of the report, just so that you are assured that we are following our processes insofar as identifying where harm has occurred, and that we learn from that and put in actions in place to prevent similar situations from occurring. We provided information on how we're learning from deaths, and I've already mentioned that we continue to be really open and ensure that where incidents have occurred, we are making that duty of candor contact. So what will usually happen is the team would have already made contact, but subsequently to an investigator being allocated, they will also continue to do that duty of candor conversation. So we ensure that that is robustly in place. So just to highlight that last part for the board to note what has been reported within this report. I'm happy to take any comments or questions, Chair.
Thank you, Linda. Very comprehensive. Robin?
Just going to come back to this nagging problem of the lack of investigators, as to whether there is any other solutions, anything that other trusts are doing that we could look at to try and address this ongoing issue, because it just goes on and on. I know it's improved, and I know the improvement, but it is one that we really are struggling with, isn't it, Linda? And I just wonder if there is any other solution that is out there. It's an open question.
Linda, can I just add to that? what impact does the change to PSERF have as well on the number of investigations we'll need to do going forward? So that's just an addition, really.
Yeah, so I'm happy to come in, Chair. So
Yes,
the first bit around what Robin has mentioned around, is there anything else we are doing? Yes, there is, Robin. So one of the issues was around training for investigators. You'll appreciate that coming out of last year, certainly for mental health, learning disabilities, where we've got more investigations, we had the requirement for clinical colleagues to then complete mandatory training. So that then meant we're prioritizing the mandatory training, which actually slowed down the training of other colleagues who would otherwise be picking those up. So we've picked up on the training because people do need to have training. And then there'll be those who had training, but it was some time back and they need refresher on that. We've also got colleagues who we're really happy have been promoted, moved into corporate roles. So a review of that between myself and Anne has also increased the capacity, where we've said, actually, we don't want them to lose those skills. So we are then allocating to those individuals, bearing in mind that we need to allocate to the people who have the right level of skill and expertise. We also have other cases that were previously allocated, but then we've had to then reallocate because it then comes to light later on that the investigator has a conflict of interest. So that then means we're bringing it back to then start the allocation. So yes, we've done other things to increase our capacity. So we should see the position start to improve. With regards to your question, Christina, around the impact of PISA. So one of the areas that we are doing a lot of work on, so Richard Smith, Dave Mayer will be aware of this, is with regards to the investigations that involve the coroner. So for a lot of our incidents, and prior to PSERF, all of those would have had a serious incident investigation. When we look at the PSERF and its guidance, we would look at this for learning. And we are still doing that work with our coroners because we know that for the family, this is something that they'll be looking to. So we would then be relying on our structured judgment reviews, our SJRs, and providing the information in another way, which then means we wouldn't then be doing as many of those investigations. So when we look at areas like pressure ulcers, where previously all of those would have then been a serious incident investigation, we're looking at the ones where it is different, where there has been that lapse of care, and then we would put it through the process, as opposed to where we previously would have been mandated to then put all those through an investigation process. So we will start to see those numbers reduce, but it does not mean to say we're not reviewing the incidents, we're not involving the family or the patients. It's a different process that we would be utilizing to do that. So we would still be reporting the number of incidents coming through here and then what has happened to it following on from that. And some of that is in the report where we've reported through our Rose Forum, no further action, those that are now patient safety incidents that we're investigating. I hope I've been able to answer you, Robin and Krishni.
Thank you, Robin. You happy with that? So I think the nub of that, my sense is, I mean, clearly a lot of work going on to try and make sure we've got the right level of skill, but also that there will be a different, the PSERF introduces a different approach, really, that potentially requires some, certainly incidents to be investigated, but actually where the learning is really that the key is it's understanding what learning we can get out of these and not following slavishly an investigation process. I think that's probably not the right set of words, but it does seem like the two together might help us going forward. But Robin, I think it sounds like Julia and you were already looking at this through quality committee, so no doubt you will seek further assurance in your next meeting on this as well. So thank you, Linda. We note that report and a very comprehensive report as ever, and the learning, etc. that's been highlighted. Move on then to paper O, please.
So the next paper is reporting on the monitoring of our workforce safeguards. So this is where we look at our safer staffing. I will take this paper as read. Just to note that we've moved this report to a AAA format of reporting for ease and understanding of the report. So hopefully you'll find that it's more digestible and an easier read report. We continue to report on our vacancies for registered nursing and healthcare support workers, and a lot of work being done to address that, including celebrating our success on the internationally educated nurses who have come into our organization. Just to make mention that we did have internationally educated nurses share their journey, their experience at our previous nursing conference, and that was really well received. We were also profiled in the local media, having celebrated our 50th nurse arriving, who had a really positive experience to share and continues to be somewhat of a local celebrity in sharing her experiences to date. Within this report, we've reported on the establishment reviews that have taken place, with the data collecting starting and then the subsequent confirm and challenge meetings that are taking place. We are not asking board to approve any sort of additional staffing requirements at this stage, because there's still the ongoing triangulation in the background around some of that. And of note, what we do recognize is the tools that we use have been set, but we've started to do our skill mix, which is then not captured by the tool. So for example, where we've introduced some of our apprenticeships, they do not appear within that reporting model of the tool. Where we're trying to introduce our advanced clinical practitioners, that does not appear. So there's some work that we then do through the confirm and challenge, which actually would not then be reflected in the tool, but wanted to share that we have started that work on our establishment reviews. I also wanted to make note to board that the community nursing safer staffing tool has been paused for 3 months. There was some what would call sort of noise descent around this on social media. So I did have a conversation with the national lead, Paul Vaughan. So I met with Paul Vaughan last week so that we could get the messaging right, and I could also get the understanding around that. I also communicated this with my counterpart in Leicestershire Partnership Trust, that we both received the same message, that it's actually paused so that they can allow for a review of the tool. It's 18 months in, and there were quite wide variations when the tool has been applied, including an area that was cited that required circa more than 88 whole-time equivalent community nursing posts if they were able to deliver that. So they're trying to understand a bit more of that. For us in NHFT, whilst there is this pause, what we are going to be doing in the background is to do our own review and analysis of the tool and understand what it's told us so far. So whilst it's paused nationally, we've got some work that we can actually catch up on that as well. And feedback is being requested from all organizations around their application and experience of the tool, including for ourselves, who were one of the pilot sites when it was initially rolled out. The last bit that I just wanted to share within this report so that it can be noted is around the fact that we continue to see a lot of activities, and it is really busy for our teams. However, we are continuing to monitor situations where staffing has been alluded to incidents, so we do review that to look at the impact, and we've spoken earlier around impact on patients, so we continue to do that. We've then detailed within the report your consideration that we are actually reporting on our vacancy fill rates. We upload that nationally through Unify and have shared that information within this report. I'm happy to take any comments or questions, Chair.
Thank you. Any comments or questions? I think helpful to sort of receive it in a different format, I think, to have that refresh. So thank you, Linda, for that. Anything to comment on? Are we happy just to note that? Angela?
Yeah, no, very, very comprehensive and clear. I just wanted to add for the board that as we go through programmes of work, we're reducing agency, off framework and locums, really important for the board to be aware that safety is still paramount. So the opportunity to obviously bring people in according to safety needs is still there. So just to remind the board of that. Thank you.
Thank you very much. And actually, Linda, just a small aside, but I was recently visited Cransley Hospice, and they had an international nurse there, and the feedback from the staff was incredibly positive about the impact that that individual had had. So it was really good to hear from her as well about her experience and the support she'd received. So really good experience to see that, see a nurse very much embedded within the team there. So thank you. So we note that report, and Linda, we move on to the 2 complaints reports. So one obviously is, I think, our sort of our standard report, and then one is our annual report. So in the interest of time, if I could just ask you to be brief, perhaps on just focusing on the alert bits of anything relating to the complaints, and then annual report key points. Thank you.
Yeah, thank you, Chair. So this is the Complaints, PALS Feedback and Involvement Report for Q4 2023 to 2024. So just closing off the financial year.
Yeah.
Detailed within the report is the area to sort of alert on the activity levels working within our complaints and how we're responding to those. What I did want to focus on within this report is right in the middle of the report, where we've included the draft carer strategy. So this did go through to Quality and Safety Committee, where we received really positive feedback as well as areas that we could improve on it. But what we needed to share here was the draft report that went there, and the ask that all the amendments that we're doing can then go to the next Quality and Safety Committee, which will be next month. So just wanted to share that we've taken on board the comments and the feedback that was provided, which is really useful and helpful to us. We've tried to put all the information into one report. We're still working on how we then include all feedback so that it is all feedback. So that work continues to be ongoing, Chair. We are modifying this report, so we will start to see it as a full feedback report, and then the tabs for the different statutory fields that we report on, like our complaints, like our PALs, and then other feedback with a useful discussion that we receive feedback through other platforms, including things like our social media handles. So how do we then put that in place as one level of feedback? So that's to do with our Q4 report. I'm really pleased to be able to present our draft annual report, and what we've tried to do with the report this year, which will be different from last year, is to make sure that we've included all the feedback. So we've got our complaints, we've got our PALS, Patient Advice Liaison Service, and then we've also included feedback from our insights within this and the work that has been done to move from our previous feedback provider, which was I Want Greater Care, to our new provider, which is Equivia. We've detailed within this our areas of focus and priorities for the forthcoming year, and you will note that it is being presented headed as draft, subject to comments, approval from this trust board, where we would then be able to finalize this report, remove the draft, and then be able to publish it on our website and share with other stakeholders. I'm happy to take any comments and questions on these 2 reports. Thank you, Chair.
Thank you, Linda. Judith, please.
Thank you, Krishna. Linda, really fantastically clear report. Thank you very much. The only question I've got is that I was really pleased to see the carers report, the carers strategy, which is again really detailed. I know it's been discussed before, but it was good to see it appended to one of your reports. The question I've got, bearing in mind we've just discussed high-level strategy for the trust, is the carers strategy refers to a number of initiatives that will be carried out this year, which impact on estates, impact on training, and also on workforce plans. So just really wanted to get that assurance that these plans are actually already sort of part and parcel of the overall strategy that we have just discussed, so that there is in fact funding available, and that estates are involved in ensuring that the carer strategy can be delivered at the end of this year.
Linda, can I just bring Melanie in so that we can just pick up her comment, and then you can respond to both at the same time, if that's all right, Melanie?
Thank you. Yes, I merely wanted to say that we get these quarterly updates, and it reminds you of the huge level of feedback that the trust receives, which many trusts, I'm sure, would be either overloaded by or just sort of park. But it never ceases to amaze me the amount of effort, time, and energy that NHFT put into responding to the feedback and learning from it. And I think the annual report sums up that sort of huge level of assurance that I can take from the way that the trust listens and responds, and the various examples given. And I also just wanted to personally thank Linda for listening to my sort of copious amounts of feedback delivered in no particular order on the report and the responses. She already had a huge plan already in place to drive the report forward, of course. But she was very patient in listening to my feedback, and I'm delighted to see the sort of beginnings of the improvement and the work in progress that you refer to, Linda. So that's all I wanted to say. Thank you, Krishna.
Thank you, Melanie. Yeah, I mean, I think it's really positive to see the development of the report. Another report, I think that's been developed further. So coming back, I think to Judith's question, Linda, is just about making sure that the carer strategy is deliverable in the context of the overall strategy that we were talking about a little bit earlier, and that anything that's needed to enable that is actually built into those plans. Is that something you're confident in, or do you need to take that away at all?
Yeah, so I'm happy to do two things, take it away and come back, but also just to provide some assurance you did. So one of the things that was done, which Mel and certainly Robin, Dave may all be aware of, is in coming up with this strategy, we involved key stakeholders. So it was important that we didn't go into a room and just agree what we thought carers would need. So we took a different approach, and that's why it took longer. It also meant that those working on the strategy are involved in other groups within the trust where they can raise these issues. So one of the things that we know certainly is that for us in NHFT, we are ambitious. We're not blind to the financial constraints, but what we are assured on is that safety is at the heart of what we do. So when we start looking at things like our estate, I know certainly Janine is here today, she will confirm that where we've said this is not acceptable, we're then looking at an alternative that we can use. So it's not to say we're going suddenly to build something new, but actually we've done this before where we've agreed that this is in suitable estate and actually had people rehoused to use something else. So our commitment for this carer strategy is to actually deliver it within the timescales that we've mentioned. We do want carers to be at the center of this, and taking on board the feedback we got at Quality and Safety Committee around, if I'm a carer, what does this mean to me and where can I see it in the strategy? So those are the other areas that we will then articulate clearly within the strategy. But certainly I do want to assure you, Judith, that it's not been done in isolation of other areas within the trust. So when we talk finance, estate, digital, we've not gone outside of that. Comms have been very key in supporting this as well. So we've tried to really sit down and get all key people involved in bringing us to this document we are sharing in draft today.
Thank you, Linda. So I think, Linda, you were asking us, because this has obviously been reviewed at Quality and Safety already, and I think obviously amendments are requested and have been incorporated. So I think you're asking anyway for it to return to the Quality and Safety Committee and for final sign off, which I think we're happy to support and make sense, so that the Quality and Safety Committee can be clear that what it's asked for has been addressed. And any further questions about how the deliverability, I think, can be perhaps picked up as part of that. Is that okay, Robin, in Julia's absence, for you to take back? And Linda, I think you're asking us to receive the annual report, which we are required to do and publish. And I think the board is happy to do that. And thank you for all the work that Melanie and others have commented on which is so important in responding to the feedback that our patients and members of the community give us. So thank you, Linda, for that section. We move on then to the people section of the board. We have one report today, which is a sort of integrated equality information report, which includes RES, DES, or WDES, and EDS, Equality Delivery System. Chris, over to you.
Yes, so I was going to draw out the main themes, Christine. Happy to take questions. As Christine's highlighted, this is a new style of report. A lot of these reports will come separately previously, but we've agreed they should come as an overall equality report so that you can get a good oversight of what's happening. There's a lot of data in here which indicates how we're progressing or where the challenges are, but important to underline that's only part of what we do. Have a lot of dialogue with our ECM colleagues and our disabled staff and staff with long-term conditions, and that informs what we do. And just some of the main themes. So the representation of ECM colleagues has grown within the trust, which is very positive. And we actually have a much higher proportion of ECM staff within the trust than in the local community, but that's very positive for recruitment, which is a key part of quality, having substantive staff. We have had some challenges, so we've had a deterioration in the likelihood of ECM staff being appointed. However, this is something we were aware of through the discussions, and we've highlighted in the report we've developed a really impactful initiative on inclusive recruitment, which managers are attending, and we've co-produced that with the Reach network who attend the training, and that is really informing change in terms of people's attitudes, but also our processes and what we do with that. Also had a slight deterioration in the frequency of ECM staff going into disciplinary, but that's an improvement on 2 years ago, an increase from last year. But we do have the decision-making group, and this is an indicator that's subject to either the number of cases there are or what particular incidents happen and who's involved. But it continues to be a real focus, and we are going to be reviewing that. We've had a really encouraging increase in the number of ECM staff who've responded. It's almost doubled, and I think that can be taken as a clear indicator that people are feeling that they can feedback. They feel confident that they can feedback, and that's obviously flown through into the into the report. On the people promise, our ECM colleagues are reporting equal or better than our white colleagues, which again is a it's a positive development. On the bullying and harassment, we've had a 1% slight deterioration on a couple of them, but a positive increase in less people experiencing discrimination at work. Also, our board representation has improved. In terms of where we are making some good progress, but clearly we've still got some real challenges. We know that. We've got a comprehensive plan. We've got both the Together Against Racism plan, which is clearly impacting. We've got the RES plans, and we do have, it's important to share, we have really detailed dialogue with our Reach colleagues and ECM colleagues as we co-produce things. And I think some of these are core indicators, but I think they would say that they feel the trust is really committed to getting this to the right place and moving it forward. That's really important. On the WDES, I mean, probably overall a more positive picture. We're ranked 9th nationally. We're shortlisted for HPMA Award for our work, our work in supported disabled colleagues. We've also had an increase in the number of colleagues identifying as disabled, and this has been a real issue that people feel confident that they can register and take that forward. The likelihood to appoint for disabled staff is virtually in line with what's required. Slightly higher on the entering performance, but again, that's one of these things where it's very small numbers of staff, so that is a bit of a challenge within that. Bullying has increased for patients and colleagues, but reduced for managers, so kind of two different pictures. There's been a significant improvement in staff feeling pressure to come to work, that they don't feel that. And equally, we maintain the 86% on reasonable adjustments, which puts us 13% ahead of the average, which again is some really, really positive results. And again, in terms of being nominated for the award on neurodivergence and where we're ranking, I think, and the Enable network, which both Melly and I are involved in, I think they feel they are well supported, and we are again moving ahead. The EDS sets out how we look at services. There are 3 areas described in that. Assessing services and which is diabetes and spiritual well-being, workforce well-being and inclusive leadership. And the trust has been assessed as either achieving or excellent in all of those areas. Again, in terms of our quality objectives, you've seen we've made positive progress on all of those, but we are now moving those to an annual basis so we can review them and set some challenges for us moving forward. As I said, we've got the TAR programme, which we've been working on for a while. We launched a new comprehensive programme in January. 3 key areas: workforce, patients, service users and community. They have 3 or 4 key areas under them, and we've agreed standards across the 2 trusts, done a gap analysis and identified the action plans from those, which are all moving forward. And as I said, inclusive recruitment is a really positive example, as is all the Say No to Racist Patients, which we've shared with the board, the work that's gone on about that. So what we're asking is that the board takes assurance from the report, that we support the information data to be presented to NHS England, and really just to emphasise that we are making progress, but there are still those key challenges, the hotspots. We're very focused on those, and we've got comprehensive plans in place that should allow us to continue to make progress and address where we've got real challenges. Thank you.
Thank you. Thank you, Chris. So questions or comments? Okay, just, I mean, I think, oh, Angela?
Yeah, just to say that, you know, really good description, Chris, of all the work that's going in. And as Chris has highlighted, we don't rest on our laurels here. I think there is still work to do. It'll never be finished, and it is, you know, our cultural piece. But I think increasingly, as Chris has said, people are sharing their stories. And this is really important when we look at data, because data is one thing, but people sharing their stories and triangulating that with our actions and the data is really what makes it possible to make the difference. So I'm encouraged that we've got all sorts of different angles coming on that, but as ever, more to do, but really pleased about the work that is happening, I would say. Thank you. Thank
you, Angela. Joe?
Yeah, thanks, Chris. I think the one comment I would make is, yes, it's certainly that there are some unfortunate backward steps on some indicators. I think, given the amount of interventions that you've talked through, which is, you know, really good practice, it would be great to have quite a frequent pattern of reporting back on some of this stuff, because, you know, speaking to Angela's comments, you know, this is part of the culture of the organisation, and if people coming to work, you know, are experiencing bullying and harassment, it's something we really need to hit hard and understand what progress we're making. Otherwise, Linda's previous papers about recruitment and retention will become more of an issue if the reputation of the organisation is damaged by continued experiences, negative experiences by certain groups in our community. But yeah, great progress, but I just would really like to feel confident that we can have tight reporting cycles on this, please.
Yeah, I think we could definitely. Sorry.
Sorry, Chris. By all means, come in. I suppose the one challenge we'll always have is that obviously some of these results are annually, they're annual, and we can't change that. So it's what we can do that helps us understand progress, and it might be useful just to highlight the role of the Equality and Human Rights group, which UDIT goes to, I think, and is involved in. So
yeah. Sorry, Krishna. Yeah, I know they're annually reported, but that doesn't stop us as a trust doing monthly pulse surveys or using the networks we have to get more timely feedback on the interventions that Chris has just talked us through. Thank you.
I think there's, Krishna, I think some of the figures are hard, because if you do them more regularly, it doesn't necessarily give you the time or for the response to changes. What I think we can do much more of, though, is we can share the narrative and the feedback from the reach networks and where people are, and we can demonstrate how things are being moved forward, which I think I think what you're saying, Joe, is we're doing a lot, but are we sure we're getting the impact? And I think we can display that and talk about that. And I know Melanie will see a lot of that, say the Enable Network, because we do hear a lot of feedback from them and we see what's happening. And we're going to review, for example, the inclusive recruitment, and I think we're going to see some substantial changes to the way we actually do things. There's a lot of learning going on, but I think normally that wouldn't come through, but maybe it can come through to the IAC more to give more of a feel for what's happening. I think as an employer, I think the evidence is we do have a good reputation because the numbers that come to work for us. I think my reading of it is people are getting more confident to talk about when they've got a problem, because the response to the survey. So then we will hear about those cases maybe more frequently, but that does mean, I think Angela bear me out, that does mean we can take action and we can understand what we need to do, even highlight areas where we think there are problems in the trust and we need more of an intervention.
Thank you, Chris, and actually I will bring Melanie in, but I mean, interesting. One of the things that I was going to say is what would our Reach Network colleagues, because we sometimes had them in these meetings when we've been talking about this data, what would their thoughts be, or what were their feelings about the results that we've achieved, and are there any areas that they might say if they were here that we'd need to do more in this particular area, or they feel that we're not doing enough on. So I think it's we've heard their voice many times before. We probably haven't heard their voice for a little while, other than for those of us who've had the privilege of going to, for example, the Together Against Racism launch programme, where obviously a number of colleagues were represented. Interestingly, one of the Reach Network, as Sakib alluded to earlier, is going to be one of our new staff governors, Heba. So I think that's going to be really helpful, because we're going to be hearing her voice very much through the Council of Governors as well. But I did wonder, on a practical note, whether there could be a AAA from the Equality and Human Rights Board, and whether that could feed into integrated assurance. That might help. That's just a thought. Whether that might be helpful. I don't know, Judith, if you have any views on that. I'm not sure who chairs that. Is that Angela?
No, I chair it.
You chair.
Yeah. Christian, yeah, I have been going. It's currently, and Chris, please jump in if I'm talking out of sort here. It's currently the governance of that committee is currently being reviewed because of the new Human Rights Committee. So it's a little bit of flux as far as I can sort of make out. But I do go regularly. I'm not 100, again, Chris, please jump in, not 100% clear as to how that board reports up to here, because that's also called a board. So again, there are these issues are being worked through. But I'm really happy to discuss with Joe the content and share that. That's not an issue going forward.
Thank you, Judith. Melanie, please.
Hi, yeah, a couple of points. I think we've actually shone a light here on something that we've maybe not quite developed fully, Tim, for the Integrated Assurance Committee, which is that there are probably a number of groups or committees that sit under the integrated, or sit within the sphere of the Integrated Assurance Committee, that aren't currently doing reports up to it, like the Wellbeing Steering Group, like the Human Rights Board, or whatever that sort of morphs into. And I'm also thinking, Angela, that the Diversity Network Leads meeting probably kind of coalesces a lot of the feedback from these networks, particularly around areas like this. And again, maybe it's appropriate that should feed into the IAC, or bring a sort of a quarterly overview to the IAC as well, to inform the overall workforce view. The second point I wanted to make was specifically about the Wellbeing Steering Group, which of course in its dashboard reports, Joe, DATIC's reporting of any bullying or abuse of staff. So we do monitor on a monthly basis anything that gets reported in DATICs. But of course, we know a lot of this kind of activity maybe doesn't. And the third point I want to make was it is really important that we triangulate this kind of feedback with the freedom to speak up insights, because it's in freedom to speak up where you tend to start to get an insight into pockets of, you know, a team that is struggling with this kind of behavior, or even sometimes just an individual. So I think it's really important that all of those different insights come together. And yes, there may be some more regular reporting possible, but I think we have a lot of information. I think it's about triangulating it all. And that really should be the role of the Integrated Assurance Committee at the end of the day, to bring a perspective on that. Will be my view.
So
Thank you.
potentially, I mean, I'll bring Angela and Chris in, but I think there is an opportunity for us, you know, picking up Joe's point, to think about how we, because there are loads of things happening and forums that are in place, but the visibility of that is probably less in a board committee specifically. And given Melanie's point about the Integrated Assurance Committee and its role, you know, however that develops as well through following the well-led feedback we shall be looking at shortly. I think all of it just gives us that opportunity perhaps to raise the visibility, so that Joanne's point is we're not waiting it's not an annual report, but we are getting that assurance that the activity is underway whilst we're waiting for obviously annual reporting cycles to take place. Angela.
Yes, I think that's really, really helpful. I think we would benefit from some sort of governance schematic that, as you say, starts to describe some of the more formal, but also those meetings, like I will chair the diversity network. I meet with the Reach Chair network chairs across here and LPT together and separately. Those sorts of things are all feeding in, and I think it'd be really useful to see that in an illustration for all of us, because there's so much going on. But at the same time, I think we've also got to consider how we're also shining a light on celebrating successes here, and also the allyship that we've also got across the organisation for supporting staff networks. And perhaps we need to bring that out a little bit more as well. There's something about that. And equally, we probably need to get into understanding a little bit further what our cultural cliques are in the organisation, because they will be there. And actually, are we clear and confident about them? So I think there's a few things we could explore, but that schematic of a network of what we're doing would be useful, because the leadership work that Chris is doing is also connected to this, because we're trying to make our leaders conscious leaders. And that's also very heavily part of this programme.
Yeah.
Thanks, Krishna.
Thank you, Angela. So I do like the idea of the schematic, because I think that might help for people to visualise where a number of things happen and who's involved in them at different points, not least all the different networks which board members support as well individually. Chris, final comment from you?
Yeah, so obviously can come in earlier. We've actually, Dave's aware of this as well. We've done quite a lot of discussions about this, because obviously Tim's already highlighted the development of the IAC. The Strategic Workforce Group reports into the Integrated Assurance Committee. A number of the groups we've talked about, like the Wellbeing Group, report into it, but we've also highlighted that we need to actually encompass all of them. So we've got a workforce planning group, a medical workforce planning group, wellbeing group. We've also got the recruitment and retention group, and we have worked up kind of an outline schematic for all these things to start coming into the Strategic Workforce Group, which is the core exec committee that would then feed up to the IAC. So just to assure the board, we've already put a lot of work into this, because we understood there's an issue there about the governance and how do we bring it through. I think equally that should allow us, as we've got the new DBQ plan, I've certainly been thinking that we need to think about maybe how we report on some of the progress on the, in essence, the people plan that is in the grow element of DBQ now. So I think all these things that people are raising at an exec level, we've been through, we haven't finalised it yet, but we're certainly getting there. And I believe that should really address all the points that were raised and how we get more of a grip on all of this. But I do think, talk about celebrating success. I think, as Tim said about the IAC and also the SWG and these others, as I think you said you said about a year and a half ago, Krishna, that you felt we did well on workforce and we didn't have a problem as coming to the board, but lots of trusts had an infrastructure for it. And did we need that? And I think we have made huge strides to building that infrastructure now and being able to understand it and being able to involve people in it. And I think from a governance point of view, that's really, really important for us to share and move forward.
Okay, thank you very much. So, so I think we've agreed that probably something that just pulls that picture together would be helpful. I think, and then as part of a sort of the review that's ongoing anyway, and taking account of the Deloitte's feedback and the annual effectiveness review, all of those things I think will just probably help us to get a sort of clarity on how we monitor the people agenda. And I think really important to think of EDI as part of that wider people agenda, because I do worry if we separate it too much. You know, it's to Melanie's point, it links to well-being, it links to freedom to speak up, all these things connect together. So actually being clear about how we monitor it as a whole as well is really important. So just a little bit more work clearly to do to clarify that, and then hopefully, Joe, we can respond more clearly as to the role of IAC or whatever the mechanism is in doing that more frequently, so not waiting for a year before we get another further update. Is that okay with you, Joe? Great. Okay, thank you, Chris. I think we support the submission of the data, which we're required to do, and will feed into NHS England's analysis anyway and otherwise. Thank you for all the work. Obviously, huge amount of work underway, and we commend our networks, as we have done, for the support they've provided and the co-production role they play with us in producing the actions that take us forward with this. So thank you. I'm really conscious of the time, so we're going to need to crack on and go to the Audit Committee AAA report, please.
Okay, and in the interest of time, I'll take us, I guess, straight to the Celebrate and an update on the meeting we've just had. So on the Celebrate, we had a green on our counter fraud. We also had a reasonable assurance on our head of audit seeker, and that was confirmed at the ad hoc meeting that we had on the 24th of May. There were some outstanding reports that had to be brought to the 24th of May, and we were complimented on the fact that we had 7 reasonable assurances rather than substantial assurances, which Scott said, how do we get to them? And I think obviously as a growing outstanding organisation, obviously we aspire to see how we can get there. And I think it was commented that I think whilst you sometimes see ones at the bottom of the pile, I think in 20 years you'd never seen one at the top of the pile getting a substantial assurance, but we can still aspire for that because that's the type of organisation that we are. So I think on the whole, you know, that whilst we have some findings that we have to still work on, there was nothing major to cause concern, and obviously the audit will be signed off, and then we will have our meeting in June.
Thank you, Saqib. Any questions in relation to Saqib's report, which is very comprehensive? It's really good to see the work on counter fraud, actually, because I remember, Melanie will remember, it was the previous audit chair was always trying to address some improvement needed around counter fraud. So to be getting some positive recognition around that is really good.
I mean, I was hesitant because over 9 years I've been told that if you get a green, you're more likely to get a visit. But this time we were told that if you deserve a green, you should go for a green because you're probably going to get a visit at some point anyway. But I think we should take the green and be happy with it.
Thank you, Saqib. Any other comments or questions? I note actually just in relation to the annual governance statement, obviously we've got that on the agenda and the audit committee did do a review of that, I think, as well, didn't it? So it's important to note that in the context of the next item, because that might shorten the need for a discussion, conscious of the time. So thank you, Saqib, for the report. If there are no questions or further comments on that, we'll move on to paper T then. Richard?
Thanks, Krishna. Yes, you've somewhat stolen my thunder because I was going to say I'm not going to go through the detail here, given that the audit committee has reviewed the report. So we'll instead just note that there are no significant issues of internal control to report. This is a draft version of the report. We do need to factor in the outcomes of the last audit committee meeting, where we received the head of internal audit opinion and final audit reports for the year. So that section of the report will be updated, and of course the board will get the opportunity to scrutinise the final version of this at the ISO 260 meeting in mid-June. So happy to take any questions or comments. Thank you.
Thank you, Richard. Any comments before we move on? Thank you. So we know we'll be receiving that back, obviously, as you say, Richard, and we will be making final approval at our ISO 260 meeting. And then self-certification of compliance with the provider license, please.
Thanks very much. Yes, I'll take the detail of this paper as read. Just to note that we are no longer required to submit self-certifications to NHS England following some changes in legislation and subsequently the national guidance. Nonetheless, we are needing to ensure that we are assured that we are compliant with the provider license conditions. We've obviously now got a new version of the provider license, hence the table on the first page matching up old requirements and new requirements. Again, you can see that we aren't flagging any significant issues or concerns with our compliance in relation to the conditions specified within this report. And as more information and guidance comes out from NHS England, as this is linked to the public consultation underway at the moment on the NHS oversight framework, we'll then reconfirm our future self-certification reporting approach for future years. But happy to take any questions or comments on this particular paper, and as I say, we'll revert back to the board once future requirements are clearer. Thank you.
Thank you. Any questions or comments in relation to that? Okay, I think it's therefore we are being asked to support and approve it, aren't we, Richard? Because we will add our signatures to that and file it. But we did agree, I think, in conjunction with LPT, that we would both do this process. We felt it was good practice, and having done it before, we would maintain it for now. Obviously, any new requirements, as Richard said, will be factored in going forward. So if the board is happy, we will add our signatures to that. So thank you. And then finally, Richard, we've got the annual effectiveness review that you might want to comment on.
Indeed, thank you, Krishni. So this is set out in paper V. Board members will recall we slightly deferred to the start of our process to take account of some feedback that we will hopefully soon be receiving following our external well-led review. So accordingly, we've mirrored the approach that we took last year to board and committee reviews and proposing to start the process in June. We've allowed a reasonable period of time to actually conduct the surveys and then have engagement workshops and discussions. Hence, we'll be bringing back, or are proposing to bring back, the feedback from all of those reviews, committees and board to the meeting in November. That was on account of some learning from last year, actually allowing sufficient time to do that. So you can see in the report the proposed set of questions that we will be using, as I say, factoring in some feedback from the external well-led review along the way. So we'll continue to use the Evaluate platform and have discussions as we've done with committee members in previous years. So happy to take any comments or questions, and then we'd ask the board to support the proposed approach, which will then initiate over the coming couple of weeks. Thank you.
Thank you very much, Richard. Any comments or questions regarding the proposed approach? Broadly content. I think the only thing I wanted to observe, Richard, was that obviously we've said that we will have regard to the findings of the Trust Externally Facilitated Development Review. I'm conscious that in trying to do that there may be some changes to the wording of questions or some things that we might want to examine once we've understood the content of that. And that's my only reflection, that we might, if we rush to agree the questions now, we might actually miss the opportunity to sort of build something in that comes out of the well-led review that we're not all yet kind of understand or are fully cited on. So I just wonder whether we could agree those as provisional questions, but almost reflect on, once we've kind of got the content of the well-led review, whether we can actually just say, right, are there some additional things or different things we might want to ask? I don't know how that would work though in terms of timing. So could we do that, given that we've got our workshop coming up? Is it next week now? Joint workshop?
Indeed, Christian, they're a really good suggestion, actually, and we're certainly looking at the timings that we've allowed for here. We've certainly got the opportunity to do that within the times set out. So yes, we're happy to take that on board.
If everyone's content, then we can perhaps just revisit. Maybe Richard, we could do that rather than wait for the next board. Just revisit, you know, send the proposed questions or any reflections that we might want to build in after we've received the well-led review, and then we can just confirm that we're happy to go forward on that basis. Great, thank you very much. So we've agreed a way forward and support the proposed approach, taking that into account, and the timetable that Richard has proposed. Finally, we have the group joint highlight report. Alison, I think it's probably a bit unfair to ask you to present this, as I don't think you were there, were you, or were you at the meeting? Were you there at the joint working group?
Yeah, I think I probably was, but I understand. Sorry,
Okay.
Judith, I'm going to look at Judith. I was told or assured by David that Judith would probably be presenting, but I have got some
no, because it would have been Julia, but she is not.
Apologies,
yeah,
Julia.
but she's on holiday.
Yeah.
You did look immensely concerned at the idea that she might have to present. But obviously I was present. I think we can we just take the report as read and go straight to questions, because I think that's probably helpful anyway, and just bring, you know, other colleagues who are present can also highlight anything that they particularly want to. So would that be okay? Does anyone want to bring up anything that came out of that meeting? I think it's a really good opportunity. I mean, I will probably just reflect that I think we pretty much reviewed all the strategic priorities as part of the discussion. The only thing we didn't, we recognised we needed to look at further was the research and innovation piece, which we were going to focus on at the following meeting. I do also want to mention that actually, as part of strengthening really the remit of the joint working group, we will. I have asked an extra NED from each trust to be part of it, and UDIT kindly agreed to join the joint working group. So that would be in addition to the two deputies and myself, and obviously exec colleagues being part of that. And we ought to reflect that obviously any feedback we get from Deloitte will also help us consider the role of the joint working group going forward and how we might strengthen that. So I'm very happy to receive any other comments or questions on it, but otherwise I think we are just asked to note the report and endorse the comments within it. Happy to do that. Great, thank you. So we have a couple of items for information and the declaration of interest and the updated register and indeed the annual register for our register of gifts and hospitality. So there for information. We do just need to make sure we keep those up to date. I don't think I've got any other business to cover. So apologies that it felt a little bit rushed towards the end, but we did take a lot of time, I think earlier rightly, to talk about our annual plan, which was a big and important topic that we did cover, I thought, really comprehensively. So thank you again for colleagues for that work. Before I just move to any other feedback for around the meeting, Angela, did you want to come in?
Yeah, sorry, I just wanted to come in just briefly on the register of gifts and hospitalities, just to be clear on transparency. In my item, it just says about where I spoke at an event and was given a box of chocolates. It says I declined the chocolates. I did personally decline the chocolates, but I brought them back to Berrywood Corridor and everybody had the chocolates. So just to be clear, because the event organisers may think, well, she took the chocolates. So really important for transparency to be clear on that. And then also the APNA conference hospitality. I got recorded at LPT, but it's not come across to NHFT. So I just need to make sure that's also in the register. Thank you.
Thank you. We'll note those, Angela, for completeness. Dave, please.
Thanks, Christine. Just to note, my partner Morgan will be joining the trust as a substantive member of staff, so that I'll update on that on my register in due course. And also just to note that we managed to get to WXYY papers. We didn't get to the full end of the alphabet with a paper Z. I was wondering we might need to move to a Cambodian alphabet. A bit more letters, but near miss. Yeah, thanks.
Thanks, Dave. That's a very interesting reflection. It was quite a significant range of papers, I think, to cover today, but you'd probably expect that at the beginning of the year, and hopefully we'll be a little bit more streamlined and avoid getting so close. Avoid getting so close to Z in the future. Any other comments that anyone wants to make in relation to the meeting? Feel free, or drop me and Richard a note afterwards if you'd like to. Now, I'm really conscious that that's been a heavy load for the board. I would like you to have a full half an hour's break, so I suggest we reconvene at 13:35 for our private board. I just think you need your full half an hour break, so taking account of your well-being here. So thank you everyone for your contribution.